For brevity, I'm going to take my opening statement, just submit it to the record. Look, for many of us, we see 17% of the U.S. economy is now in the tax-exempt space. For that, we're supposed to actually see what is the value of the community good. Help us understand the value of the community good and how we're doing it well. Ms. Will.
Thank you so much, Mr. Chairman. I want to thank our witnesses for being here today. You know, our nation's nonprofit hospitals are the cornerstone of our health system, providing vital care to millions of Americans. These hospitals deliver unmatched benefits to our communities, keeping Americans healthy, bearing the brunt of care to those in need, and serving as a major employer in many of the areas in which they reside. Collectively, they deliver more in community benefit and charity care to their communities than the foregone revenue from their federal tax exemption. Yet nonprofit hospitals and our health systems are under attack. They are holding, I believe that this hearing today is a little more of a distraction than it is about the actual subject. Unemployment is on the rise, costs at the grocery store are surging, and healthcare premiums are set to skyrocket, all thanks to this administration. In the big ugly bill, Republicans made a deliberate choice to strip away more than 15 million Americans of their health care and hit countless more with increased costs and red tape while giving billions to billionaires. Their refusal to extend the enhanced tax credits that help so many working Americans purchase their health coverage means another 4.2 million will become uninsured, and tens of millions will see their largest premium hike in 15 years. Republicans enacted a $1.5 trillion in healthcare cuts, which are falling at the expense of our hospitals, providers, and patients, all to pay for tax cuts for billionaires. In Alabama, 375,000 people purchasing their own health insurance receive tax credits to help afford coverage. If billionaires could get tax cuts, then why not working Americans? If Republicans continue to refuse to extend these tax credits, 100,000 more Alabamians will lose their health care. A 60-year-old couple in my district earning just over $80,000 will see their costs skyrocket more than 300% by about $20,000. They would have to spend 32% of their income on the health insurance alone. Republicans have dramatically cut our health system, and they are trying to hide from their record and distract the American public. Nonprofit hospitals have a long history of operating at a low financial margin. In fact, the ordinary nonprofit hospital typically operates at a negative operating margin in most years. They also are more likely than for-profit or government hospitals to offer every type of medical service. And nonprofit hospitals are considerably more likely to provide poorly reimbursed and thus unprofitable services. These services are disproportionately needed by patients who are uninsured or underinsured. The bottom line is that without nonprofit hospitals, we will continue to see increased rates of chronic diseases, decreased access to emergency care, and an increase in premature deaths. With current attack on hospital stability through Medicaid cuts and our failure of this committee to protect access to care, we must protect our hospitals to ensure access to care and the improvement in the quality of life for all of our constituents. I'm looking forward to today's hearing, Mr. Chairman, and look forward to the testimony of our witnesses. And I really hope that we all can come to a consensus that supporting our health system instead of attacking it is what we should be doing. I yield back the balance of my time.
Now, introduction of our witnesses. William Hild is Executive Director of Consumer Research. It doesn't actually say for who, Dr. Stanley Goldfarb is chairman of the board of Do No Harm. Dr. G. Bai is professor of health policy and manager at John Hopkins Bloomberg School of Public Health. Christopher Whaley is associate director of the Center of Advancing Health Policy through Research at Brown University. Dr. Jill Horwitz is a Tolman Family Innovation Professor at Northwestern University, Pritzker School of Law, and a Professor of Emergency Medicine at Feinberg School of Medicine. William, you're up first.
Excuse me. Chairman Schweikert, Ranking Member Sewell, members of the subcommittee, good afternoon. My name is William Hild, and I'm the Executive Director of Consumers Research. Our mission at Consumers Research is simple: to increase knowledge and understanding of issues impacting consumers and to ensure their freedom to act on that knowledge. So I appreciate the opportunity to testify today as part of our continued public education campaign. This year, we expanded our consumer education initiatives to include nonprofit health systems nationwide that leverage numerous funding streams from the federal government and benefits from tax-exempt status to advance controversial political and social causes rather than serve their communities. And often, the advancement of political agendas such as DEI, gender ideology, and climate activism is easier to find on their public-facing web pages and materials than actual prices for their services. As part of our efforts to educate consumers, we issued a consumer warning detailing how several large tax-exempt health systems have devoted critical resources to infuse everyday operations with progressive ideological goals. These initiatives include instituting large-scale DEI bureaucracies, promoting gender ideology to children, and supporting environmental activism. At the same time, hospitals are pushing political agendas. Many fail to comply with healthcare price transparency rules and proportional growth in charity care. This misprioritization of politics over patients distracts hospitals from their core mission and can compromise the quality of treatment and increase costs, which can put consumers in serious physical and financial danger. Let me put this in perspective. Under Section 501c3 of the Affordable Care Act's added 501r obligations, charitable hospitals are supposed to operate for public, not private interests. The community benefit standard was intended to ensure that in exchange for tax privileges, hospitals would provide measurable benefits: affordable care, financial help, and improved services. Nowhere in federal law are discriminatory programs, the mutilation of minors, or investment in green boondoggles required. Through our research into hospital programs, public-facing materials, and leadership statements, we documented cases where major nonprofit health systems such as Cleveland Clinic, Vanderbilt University Medical Center, Henry Ford Health, Memorial Hermann Health Systems, and others funneled resources into DEI, promoted environmental activism, and performed gender mutilation procedures on children. The deliberate choice these health systems are making to prioritize political activism are concerning and costly. They require staff, program budgets, marketing, and other resources. Every dollar placed into a DEI policy is a dollar not placed into price transparency. Every dollar used for gender ideology is a dollar taken from charity care. Every dollar put towards environmental activism takes money away from staffing or capacity expansion. Are hospitals counting these programs as meeting the community benefit? Without clear and verifiable reporting, neither Congress nor taxpayers can answer that question. Tax-exempt status and access to federal funding, grants, and savings programs are public privileges. Congress has broad authority to condition those privileges on transparency and patient benefit without dictating medical judgment. Improving outcomes for patients is a worthy goal, and many hospitals do important work in this area. The oversight problem comes when community benefit is used as a vague justification for engaging in partisan political activity. Congress could require line item disclosure and outcome measures for any equity spending that is claimed as community benefit. Initiatives should focus on quality of care and patient outcomes, and hospitals should show the data. Hospitals are civic institutions that hold public trust. Nonprofit hospitals receive generous privileges because Congress expects them to deliver measurable community benefits. When systems elevate discriminatory policies, activist climate campaigns, or allow gender mutilation of children, this trust fails. Congress can restore this trust through more precise definitions, verifiable reporting, and alignment of privileges with the value patients receive. Thank you for the opportunity to testify. I welcome questions.
Chairman Schweikert, Ranking Member Sewell, and members of the committee. Thank you for the opportunity to testify today. My name is Dr. Stanley Goldfarb, and I serve as the chairman of Do No Harm, an organization of over 35,000 medical professionals and concerned citizens devoted to defending the timeless standards of medical excellence and keeping divisive identity politics out of the practice of medicine. Nonprofit hospitals enjoy extraordinary privileges under federal law, most notably their tax-exempt status. This taxpayer subsidy, worth billions of dollars each year, is designed to enable hospitals to provide care to the underserved in their communities. But instead of focusing only on curing disease, expanding access to care, and saving lives, too many are also focused on controversial and counterproductive political causes, such as diversity, equity, and inclusion, or DEI, and radical gender ideology that includes dangerous interventions on children. These practices are misguided. The problem is clear. We are witnessing hospitals that should be committed only to serving the sick, diverting their attention to political activism. They are spending millions on DEI bureaucracies and radical ideology interventions when these resources could be put to far better use. They are spending valuable time and organizational resources on these issues. This is a profound betrayal of the public mission. It is also at odds with the national priorities recently established through a series of executive orders issued earlier this year. Yet many nonprofit hospitals have been and continue to act in direct opposition to those priorities. The evidence is clear. At Massachusetts General Hospital, administrators announced in April 2024 that they would scale back child neglect and abuse reports from mothers who test positive for drugs because they feared that mandatory reporting was perpetuating what they called, quote, structural racism, end quotes. Duke University Health System, which received over $1 billion in federal funding in fiscal year 2023 alone, was the subject of federal rights complaint in March of this year for implementing race-based preferences in hiring and medical school admissions, while promoting the notion that white males are, quote, agents of oppression. Corewell Health in Michigan required every employee to sign a pledge in support of DEI or risk termination. Just 2 years ago, the Mayo Clinic pledged $100 million for indoctrination sessions about microaggressions and eliminating systemic biases and the supposed dangers of colorblindness and meritocracy. Similar DEI pledges, training mandates, and equity bureaucracies exist at Memorial Health in Illinois, Baton Rouge General Hospital, Maine Health, Kaiser Permanente, and Providence Health System, just to name a few. This politically charged approach to healthcare management is built on the false premise that our medical institutions are mired in bigotry. America's doctors, nurses, and other healthcare professionals are not racist, sexist, or homophobic. Rather, they work tirelessly every day out of love for the common humanity they see in all their patients. Radical ideology in our healthcare system is also seriously affecting our most precious patients, America's children. Between 2019 and 2023, nearly 14,000 minors underwent some form of medical intervention marketed as so-called gender-affirming care, including puberty blockers, cross-sex hormones, and more than 5,700 irreversible sex change surgeries. Many of the hospitals most deeply involved are nonprofits, including Boston Children's Hospital, the Children's Hospital of Philadelphia, Seattle Children's, Children's Minnesota, and Children's Hospital in Los Angeles. While all of this has been happening in our country, other nations have been rapidly rolling back those policies. The United Kingdom, Sweden, Finland, and others have taken significant steps to protect children and close this dark chapter of medical history. Chairman Schweikert, Ranking Member Sewell, and members of the committee, your leadership on this issue is vital. By exposing these abuses and demanding change, you are defending both taxpayers and patients. The American people should not be compelled to subsidize ideological agendas in the name of healthcare. It is time to restore tax-exempt hospitals to their proper mission, serving the sick, healing the injured, and advancing medicine free from politics. Thank you very much.
Mr. Chairman, Madam Ranking Member, and members of the subcommittee. Thank you for the honor to testify. I'm an accounting and health policy professor. My views do not represent Johns Hopkins or any of its affiliations. Nonprofit hospitals have a contract with taxpayers. They're expected to advance charitable mission for the community. In return, taxpayers grant them tax-exempt status. Income, property, sales tax, all exempted. Our study, published in JAMA, shows total tax benefits reached $37.4 billion in 2021. More than half was state and local. Money borrowed at low interest rates allow hospitals to buy real estate tax-free and invest without paying tax on the return. Our new tax notes study shows nonprofit hospitals held nearly $500 billion on investment assets, issued $180 billion in tax-exempt bonds. So in total, generated nearly $10 billion in tax arbitrage profit. This is just in 2022. They may also access the lucrative 340B drug pricing program. Our health affairs study found many urban nonprofit hospitals have dual classified themselves as rural to qualify for rural-only perks, such as 340B eligibility. In 2023, 3/4 of urban hospitals classified as rural were nonprofits, including large academic medical centers, such as New York Presbyterian and Cleveland Clinic. Then what charitable activities do these nonprofit hospitals do? The ACA introduced community benefit reporting on IRS Form 990, including 8 categories. The category that best represents whether a nonprofit hospital advances the charitable mission is charity care. Most other categories aren't comparable across hospitals. Rich ones can hire consultants to package marketing and other expenses peripheral to patient care as community benefit. But the charity care is dollar for dollar service provided to the disadvantaged. Our health affairs study shows nonprofit hospitals give less charity care as a share of expense than for-profit hospitals. Even Medicaid shortfall, which also counted as community benefit, our JAMA Network Open study finds nonprofits provided no more than for-profits. Today, nonprofit hospitals really act like for-profits. Financial and real estate investment, aggressive debt collection, anti-competitive contracting, etc. But the tax-exempt status was granted to them based on the situation more than a century ago, when hospitals were solely staffed by volunteers to care for the poor. It does not reflect today's situation and gives nonprofits an advantage that fuels consolidation in the hospital market. Then what should the Congress do? Just counting dollars and mandating a federal number won't work, because large hospitals will exploit bright line rules and situations vary very widely across hospitals and communities. Congress should require hospitals to disclose property tax savings, sales tax savings on the IRS Form 990. These numbers are straightforward to estimate, so local community can grasp what's on the line and local governments can tailor their policies. Congress can also impose excise tax on hospital financial investments and real estate holdings, the same way as Congress taxes university endowments. Also, close the rural-urban dual classification loophole that allow urban hospitals access the 340B program and other rural-only perks. In the long run, if Congress truly wants hospitals to best serve the community, competition is the key. Remove anti-competitive rules, level the playing field, open the market, and let nonprofit hospitals compete on equal footing with for-profits, physician-owned hospitals, physician practices, and other facilities. Also move from subsidizing hospitals to funding patients to truly empower patients. Once there's a competitive, patient-centered market, everyone, including nonprofit hospitals, will have to do the right thing for patients in order to stay in business, rather than simply focusing compliance with top-down rules. With technology advancement, competition sparks innovation, slashes prices, raises quality, and patients will get real affordability and access. That becomes the true community benefit for the American people. Thank you very much.
Chairman Schweikert, Ranking Member Sewell, and members of the committee, thank you for the opportunity to testify today. My name is Christopher Whaley. I'm a health economist and an associate professor of health policy at the Brown University School of Public Health. The focus of my remarks today is about the U.S. hospital industry, and in particular, nonprofit hospitals. I first want to acknowledge the importance of access to high quality and affordable health care for all Americans and the important role hospitals play. Hospitals deliver life-saving care that makes us all healthier and improves our well-being. Hospitals are also a key source of employment. The U.S. hospital sector is among the largest in the economy and alone accounts for over $1.5 trillion in economic activity. Hospital markets in the United States have two key distinct features. First, the U.S. healthcare or hospital sector has experienced decades of unchecked consolidation. Nearly all U.S. hospital markets lack sufficient competition. As a result, the prices that hospitals charge the 160 million Americans with employer-sponsored insurance are high and variable and have little to no link to quality and are not explained by cost shifting. Hospitals currently charge patients prices that average 250% of what Medicare pays. Rising hospital prices do not improve quality and strain affordability for patients, employers, and taxpayers. Second, over half of U.S. hospitals are nonprofit. While nonprofit hospitals play a critical role in providing patient care and employment to healthcare professionals, the total financial value of nonprofit tax exemptions exceed $37 billion per year. In return for tax exemption, the IRS requires that nonprofit hospitals be organized and operated with the purpose of primarily benefiting the community. Yet, this does not always appear to be the case. While hospitals do provide community benefit spendings, some estimates value the tax exemption exceeds community benefit spending by over $25 billion per year. This discrepancy has led to bipartisan efforts to increase oversight of tax-exempt hospitals and to further regulate their financial assistance and debt collection practices. As I highlight in my written testimony, tax-exempt hospitals charge prices, provide levels of care quality and charity care that are similar to for-profit hospitals. Yet, the substantial financial advantage of tax-exempt hospitals has led to concerns that quality should actually be higher. If community investment is not larger and quality is not superior, then where are the extra dollars from these financial advantages going? As I again detail my written testimony, I am concerned that the financial resources may be used in ways that do not directly improve patient care, including increased executive compensation, investment vehicles and account, which collectively exceed $1.5 trillion in value, and marketing, including sponsoring stadiums and sports teams. Tax-exempt hospitals also have access to the 340B discount program. My research finds that 340B savings are not passed along to patients. My research with Dr. Bai also finds that many nonprofit hospitals duly classify as both rural and urban hospitals, double dipping to receive the benefits of both, and directing limited resources away from rural hospitals. To address these concerns, Congress could consider several policy reforms. First, high and rapidly rising prices, which differ enormously from one hospital to another, but not related to quality or cost, combined with substantial investment accounts, may create the perception that some tax-exempt hospitals are operating with a profit motive. To ensure that tax-exempt hospitals fulfill their charitable mission, Congress could define standards for financial assistance and benefits to the community health sector. Second, to more broadly ensure that U.S. healthcare markets deliver high quality and affordable care, Congress and federal regulators could consider policies that prevent harmful consolidation in both the provider and insurance systems. This includes strengthening antitrust scrutiny, expanding site-neutral payment policies, and banning anti-competitive contract terms. States as diverse as Indiana and Vermont have elected to directly limit hospital prices. Third, to address concerns that 340B rebate dollars are not directly benefiting patients, Congress could ensure that improved transparency on each hospital's 340B benefit, narrow 340B eligibility, or extend 340B discounts directly to patients to improve their ability to access affordable care. Finally, Congress can also consider codifying and standardizing existing price transparency policies and ensure that hospitals report required rates accurately and in a timely manner. In conclusion, Congress can help ensure that the substantial tax benefits nonprofit hospitals receive translate into tangible improvements for patients and communities. Thank you, and I look forward to answering your questions.
Chairman Schweikert, Ranking Member Sewell, and members of the committee, thank you for inviting me to today's hearing. My name is Jill Horwitz, and I'm the Trobman Family Innovation Professor of Law and Professor of Emergency Medicine at Northwestern University, although the views I express today are entirely my own. My research concerns health policy and nonprofit law, and I've been studying nonprofit hospitals for almost 30 years. In my testimony today, I will discuss the significance of nonprofit ownership for medical care and the very important related tax exemptions. Since I first began researching hospital behavior, the distinct importance of nonprofit hospitals has only grown. In my brief time, I'll focus on 3 reasons why that's the case. First, nonprofit hospitals are simply the backbone of the American hospital system. More than half of all hospitals in the United States are nonprofit, and almost 70% of admissions to acute care hospitals are to a nonprofit hospital. Nonprofits are even more important for rural health, and they account for almost 3/4 of all the teaching hospitals in this country. Yet the vast majority of nonprofits are not moneymakers. In fact, unlike for-profits, the ordinary nonprofit hospital typically operates at a negative operating margin. So even with the benefit of tax exemption, nonprofits tend to be under financial stress. Things are likely to get worse given Medicaid cuts, declines in employer-sponsored insurance, and potential loss of Medicaid subsidies, marketplace subsidies. Given these facts, it's simply not possible for nonprofit hospitals to cover the rising costs of providing health care to the uninsured and underinsured in America. Second, nonprofits are critical because of the services they provide. Because nonprofits tend to be larger than other hospital types, they are more likely to offer every major type of medical service than for-profits are. And even accounting for the fact that nonprofits tend to be larger than for-profit hospitals, nonprofits are critical because they offer different types of services. In several studies, based on decades of data, my research has demonstrated that nonprofits are less likely than for-profits to choose the services they offer based on the profitability of those services. Comparing similar nonprofit and for-profit hospitals, for example, those that are of the same size, serving similar populations, nonprofits are more than 6 percentage points more likely than for-profits to offer pretty unprofitable services. Obstetrics, psychiatric care are a couple examples. Yet there are over 4 percentage points less likely than similar for-profits to offer profitable services like invasive cardiac care. Some of these services tend to be very expensive and often overused. They prioritize medical services that are important to all Americans. Ownership not only affects the behavior of individual hospitals, but there are also spillover effects. The more for-profits in an area, the fewer unprofitable, and the more profitable services all the hospitals in that area provide. In short, nonprofits do not act like for-profits where it counts, the provision of medical care. Finally, if nonprofit hospitals find themselves under more financial pressure than they already face and are forced to sell their assets and operations, the for-profit buyers are likely to be private equity groups. These groups are much more aggressive at seeking profits than the previous forms of for-profit hospitals that I have studied. Recent research shows that private equity owners tend to reduce competition, a problem that Professor Whaley just highlighted. They raise prices, they increase financial instability, and they have worse patient outcomes than other hospitals. In one recent example, Steward Healthcare, which owned 31 hospitals with 3,600 beds across 8 states, it went bankrupt. It endangered patients and in the end left many communities without care. The American healthcare system is facing great challenges. Needs will continue to grow given the aging population, predicted rising levels of uninsurance, and healthcare expenses, projected declines in employment, and other factors. Nonprofit hospitals provide vital and sustainable services in communities, and the services they provide are more likely than for-profits to meet important social needs. In today's market and demographic environment, policymakers ought to focus on ways to strengthen and not weaken nonprofits in the American hospital system. Thank you for considering my views.
Thank you, Doctor. And as my tradition is, I will go last in regards to questions, so I'm going to ask the chairman of the full committee to begin.
Thank you, Chairman Schweikert. Since 2014, 12 hospitals have closed in Missouri, 5 in my congressional district alone. Folks living in the communities I represent, they're forced to drive up to 2 hours for basic care, and in the southeastern part of Missouri, otherwise known as the Boot Hill, has not had access to maternity care since 2018. This is absolutely unacceptable, but our story is not unique. As patient volumes decrease and paperwork burdens increase from government and Medicare Advantage prior authorization requirements, many independent rural hospitals are overwhelmed to the point of closure unless they are purchased by large nonprofit systems that make enough money in urban areas to afford losses in rural areas. Dr. Whaley, given the healthcare and economic challenges faced in rural areas, what can we do to help fortify rural hospitals so that consolidation becomes a business decision rather than a sole lifeline for the preservation of access to care? And how can we better align reimbursement incentives so that rather than merely throwing money at this problem, we can create an environment in which rural hospitals can thrive?
Thank you for your question, and I certainly agree that rural hospital markets certainly need focused attention and are critical for rural communities. One thing that our research has highlighted is how competitive imbalances often disfavor rural safety net and critical access providers. If you are a hospital that in some sense is left out of consolidation and don't have the market clout of your neighboring competitor that has consolidated, in many cases, you are left with more Medicaid patients, more uninsured patients that the consolidated systems nearby refuse to take. I think that improving competition in healthcare markets can be something that uniquely helps support not just critical access in rural communities and hospitals, but hospitals across the board. In addition, work with Dr. Bai has highlighted how many of the financial assistance programs designed to support safety net in rural hospitals, in some cases, have been taken advantage of by hospitals that are not geographically rural. I think closing some of those loopholes can make sure that existing resources are directed to the intended rural hospitals.
Perfect. According to recent reporting, there are a growing number of urban hospitals, just like what you said, that's masquerading as rural facilities in order to get even more generous benefits under the Medicare and the 340B drug program. Benefits that are supposed to go to truly rural hospitals. According to a study published by Health Affairs by two of our witnesses here today, Dr. Bai and Dr. Whaley, over 3/4 of the so-called duly classified hospitals are nonprofits operating in urban communities. Dr. Bai, is it merely a coincidence that so many of these urban hospitals that are exploiting a loophole to gain access to benefits meant for rural communities are the same facilities that are pulling in generous benefits as tax-exempt organizations? Or is it safe to say there is a link and sense of entitlement among the leadership of the facilities?
I think the regulatory loopholes put the money on the table that these hospitals cannot resist. If Congress does not act, probably very soon the majority of nonprofit urban hospitals will become duly classified in order to access those urban rural-only perks. So these hospitals, I mean, they all work in their incentive structure, and they're going to behave according to what the incentive guides them to. And this is, to me, more like a policy failure, and it creates eventually a market distortion.
So the generous benefits bestowed on tax-exempt hospitals come with an obligation on their part to provide charitable benefits to their communities. Yet we have data showing that from 2020 to 2022, over half of such hospitals got more in tax benefits than they invested in their community. In 2020 alone, the tax-exempt benefit was worth an estimated $28 billion, while the amount spent on charity care totaled over $10 billion less. So, Mr. Hild, what sort of excuses do these tax-exempt hospitals make to justify the massive deficit between the charity care they provide and the tax benefits that they receive? And how has this imbalance been able to grow so substantially in recent years? And what should be done to flip the equation here?
Yes, member, thank you for that question. What I would say is one of the reasons that this imbalance has grown so much is that increasingly hospitals don't see themselves as just healthcare providers or even as hospitals. In the report that we put out, one of the common themes across all of the executive C-suites of these hospitals was saying that they only saw healthcare as part of their mission, or highlighting other things that they thought were core to their mission that were not, a reasonable person would not consider part of providing healthcare. So I think the mission creep of a lot of these hospitals getting into real estate investment, getting into DEI, getting into political activism, naming stadiums, this shows a lack of discipline in making sure that they stay within the healthcare provision. I think that leads to all these other things. Just like you would want to make sure that if you would want your oncologist to be a specialist, correct? You want your hospital to be a specialist. You do not want a generalist hospital. And I think that's part of the issue is you have a massive mission creep. I think in terms of solutions, one thing we should be looking for is for Congress to act to make hospitals be more explicit and detailed in the community benefits that they're providing so that taxpayers can know that they're actually providing health care and not off on boondoggles.
Thank you. I yield back.
The chair. Why is it not working? The chair now recognizes the ranking member, the gentlelady from Alabama, for 5 minutes.
Thank you. I want to thank all of our witnesses. I am highly concerned about healthcare delivery in my district. In fact, I grew up in this district. It's a rural district. People know it because my hometown, Selma, was known for voting rights. But the reality is it's a town of 19,000, and we are lucky and blessed to have a hospital. But we service a lot of the rural communities right around it. And it's disturbing to me that we're, instead of expanding and creating avenues to healthcare, today, we're really focused, at least this hearing is, on ways to harm my constituents who rely on services from these nonprofit hospitals. In my district, a number of the rural hospitals with nonprofit tax-exempt status are on the verge of closing. Since 2011, 16 hospitals across my state, Alabama, have closed. The very existence of rural hospitals is an immense community benefit. They are often the only source of medical care in their area, and they provide essential services like emergency care, screenings, and transportation. They are also major employers in the rural communities that I represent. Dr. Horwitz, can you explain how tax-exempt status allows these hospitals to continue playing a critical role in the communities they serve?
Yes, the very existence of a hospital in a rural area can be thought of as a community benefit. Without nonprofit hospitals, many rural regions simply would have no hospitals at all. This is exactly what Representative Smith just explained, right? The more rural an area, the less likely there is to be a for-profit hospital. And as you get more rural, even the nonprofit hospitals can't afford to exist in those areas. So they're predominantly government hospitals if they exist at all. So
I would assume states like mine that didn't expand Medicaid, the financial pressure is even more mounting.
Right. I think the financial pressure under the best of circumstances is very difficult in a rural area. And when you have decreases in Medicaid, it gets worse and worse. And so competition can't solve this problem because it's not economically possible to exist without subsidies.
Yeah. Hospitals in my district have been committed to providing care for my constituents despite Alabama's failure to expand Medicaid. Our hospitals have also endured receiving the lowest Medicare reimbursement rates in the country due to the unjust wage index. But those of us from small rural communities and small red states know that. Listen, I think that the reimbursement rate in this country due to the unjust wage index is abhorrent, but it's not going to change because we have winners and losers, and the states that are slightly bigger are the winners. With pending Medicaid cuts and talks of attacking nonprofit tax-exempt status, I'm simply burdened with the thought of the impact on the hospitals in my district. Dr. Horwitz, has Medicaid expansion impacted the amount of community benefit hospitals provide, and if so, why?
Medicaid expansion allows hospitals to treat more people. If hospitals need to take patients who can't afford to pay for their care, they're going to have to find the money somewhere. So I will tell you, when I was growing up, we had this saying in my house, which was, there's no money tree in the basement, right? Nonprofit hospitals don't have a money tree in the basement. They have to make their money somewhere. It has to come from reimbursement, or it has to come from profits from offering profitable services, often services that are overprovided and are very expensive for the federal government, like cardiac care paid for by Medicare, or they have to cut unprofitable services. And so if they have to do that, what they're going to do is cut services like psychiatric care, like drug abuse treatment, which is desperately needed in places with the opioid problems.
Yep. So I think that this will only be exacerbated, it sounds to me, by the big ugly bill, because it's going to cut Medicaid. So I would think that this would only compound the problem. Can you speak about that with my last remaining seconds?
Yes, by reducing Medicaid coverage, by reducing levels of insurance. If people lose their jobs and they cut employer-sponsored insurance, we're going to have worse and worse problems with uninsured Americans.
Thank you. Yield back.
Thank you very much. The chair now recognizes herself for 5 minutes. This hearing continues an important conversation that we began 2 years ago about ensuring access to quality care for all Americans and making sure that patients have fair and workable options to get the care that they need. At our previous meeting, I raised concerns about the guidelines the IRS uses to determine the nonprofit status of a hospital. And unfortunately, not much has changed. Patients with financial insecurity are still being asked to jump through extensive hoops, providing bank statements, loan records, detailed household budgets on short notice, just to find out if they qualify for financial aid. At the same time, these nonprofit hospitals continue to face only vague and limited requirements from the IRS to maintain their privileged tax status. And that imbalance, and I think my Democrat colleagues would agree with me, that imbalance remains troubling. And if anything, the stories and reporting that we've seen since this have underscored how this system too often favors large institutions at the expense of patients. We have heard a lot of stories today about how these healthcare systems are actually wasting money on Super Bowl ads, on stadium naming, on exorbitant pay for executives. I think we would all like to see those dollars being spent on patients, on making sure that healthcare dollars are actually being used for healthcare. We've seen that it's been abused. So, Dr. Goldfarb, the community benefit standard is an important piece in determining whether a hospital qualifies for nonprofit status. It requires hospitals to demonstrate that they provide benefits to the broader community.
And we want to have peace in that region, so we had some very good talks. As you know, I had President Erdogan here, Turkey, and we had a great meeting today. I think we had a meeting that was very conclusive in so many different things that we wanted, things that he wanted, and that was good. We'll be announcing that sometime later, and he'll be making an announcement too. But we had a great meeting with Turkey, and they're a very respected president, and spent time. We had lunch, and we had a lot of good discussions. So those two things, and we have some executive orders today to sign that are very important for the country. And we'll start off with one that's a proclamation. And yes, want to do that, Will?
Yes, sir. So today is Gold Star Mothers and Families Day. This is an annual proclamation. This is to commemorate the fallen, those who have died for all of our freedoms and for our country, and for their families who have suffered such grievous losses. But this is a proclamation commemorating Gold Star Mothers and Gold Star families.
Yeah, and they're great people, incredible people. What they've had to go through. Very few people could have gone through this kind of thing. Gold Star. Okay, thank you very much. He'll put it over here, Steve.
Next, sir, we have an executive order on TikTok. From the first days of your administration, you've charged a team from your administration led by Vice President Vance with ensuring that we can preserve TikTok as a platform for the 170 million Americans who use it, while ensuring that their data is properly protected as required by law. With this executive order, you will be effectively bringing into effect the agreement that will save TikTok and ensure that it can operate safely and securely.
So this is interesting because I had a very good talk with President Xi, a lot of respect for him. Hopefully he has a lot of respect for me too. And we talked about TikTok and other things, but we talked about TikTok and he gave us the go ahead. You know, it's run by American investors, American companies, great ones, great investors, the biggest. You don't get bigger, I don't imagine. And maybe I'll have JD. JD was very much involved and in charge of it. And maybe I'll have you say a few words about the deal. He would report back, and the points of the deal, I think, are great for our country. So JD, do you want to give it a little talk, please?
Yes, sir. Yeah. So thank you, sir, for your leadership and for your help. We really couldn't have done this without the president actually ushering this deal over the finish line. There was some resistance on the Chinese side, but the fundamental thing that we wanted to accomplish is that we wanted to keep TikTok operating, but we also wanted to make sure that we protected Americans' data privacy as required by law, both because it's the right thing to do, but also because it's a legal requirement of the law that was passed last year by Congress. So we think that we were able to do that. Of course, we're going to keep on working at it, but this deal really does mean that Americans can use TikTok, but actually use it with more confidence than they had in the past, because their data is going to be secure and it's not going to be used as a propaganda weapon against our fellow citizens. We're very excited about it. We appreciate the cooperation of everybody involved, and it's a big day.
And I think I can say that especially the young people, they really wanted this to happen. They did not want to have TikTok close. And I got, a little used to TikTok. I used it myself during the campaign, and it was very successful because you know how I did with the young voter. And Charlie helped me a lot too. And he said to me, you should go on TikTok. And it actually had, because we got record votes with the young voter, as you know, for the election. So I was a little bit prejudiced in that way toward TikTok. It was very good and very meaningful. But we have American investors taking it over, running it, highly sophisticated, including Larry Ellison. And Oracle, I guess, is going to play a very big role in terms of security, safety, and everything else. So we have very good controls. And literally, I would get a call from friends of mine who were fathers of young people saying, could you do me a favor? Could you get it approved, please? My son is driving me crazy. So we're getting it done, and they have a big audience, and we have great American investors. And here's your final copy. TikTok. You know, maybe if you want, we could take a couple of questions on TikTok, and then we're going to get onto something completely different. Okay? Yeah.
Mr. President,
Jeff?
Mr. Vice President, you mentioned that China was resistant. Can you describe where China is now? Are they fully on board with this?
They're
or
on
is
board.
there anything more?
I spoke with President Xi. We had a good talk. I told him what we were doing, and he said, go ahead with it.
On the algorithm, it's still being leased coming from China. Are you satisfied that there's no security concerns for the
Yeah,
U.S.
I
that
am.
it would
I really
push,
am.
it would push disruptive?
The biggest
content?
reason is that it's owned by Americans. It's, and very sophisticated Americans and people that love the country and very smart Americans too. So they don't want anything like that to happen. Yes, please.
Thank you. Is there any operational relationship with Chinese entities or staff to execute the deal?
With who?
With the Chinese?
I don't think so. Not that I know. We're going to be, this is going to be American operated all the way. And great respect for President Xi. And I very much appreciate that he approved the deal, because to get it done properly, we really needed the support of China and the approval of China. Yes, ma'am.
Mr. President, now that Americans will have operational control, do you want to see the algorithm suggest more MAGA-related content prioritized?
I always like MAGA-related. If I could, I'd make it 100% MAGA-related. It's actually a good question, but I would, yeah, if I could make it 100% MAGA, I would, but it's not going to work out that way, unfortunately. No, everyone's going to be treated fairly. Every group, every philosophy, every policy will be treated very fairly. Thank you.
Mr. President, do you know the valuation? Do you know the American company is going to be valued in billions?
Well, they valued it very highly. They're paying a big number. Do you want to talk, Scott? Do you want to say something about value?
Well, I'll let the Vice President, and then
JD?
I can follow
And
up.
you'll say something.
Sure. Well, first of all, I would say all credit goes to the Secretary of the Treasury. Couldn't have got it done without Scott. Also couldn't have got it done without Sean Cooksey on my team, so thanks to them. The company will be valued around $14 billion. We actually think this is a good deal for investors, but ultimately the investors are going to make the determination about what they want to invest in and what they think is a proper value. The most important thing is that it does protect Americans' data security. It ensures TikTok is still accessible. And on this question of the algorithm, which we've heard this a lot, what this deal ensures is that the American entity and the American investors will actually control the algorithm. We don't want this used as a propaganda tool by any foreign government. We want to make sure that our people and our investors actually make these decisions based on what's good for their business, as opposed to what's good for another government's propaganda arm. So that's what we've done with this deal. I think it's very good for the American people. And as the president said, young people love this. We actually want everybody to access this, whether they're MAGA or not. We just want it to be fair. We want it to be fair to everybody. And we think that's what's going to happen with this new arrangement.
Well, the U.S. government.
And just to follow up on the Vice President, there were two pieces to the transaction. The Vice President's office has worked since the spring for the commercial transaction between the investor groups, and then Treasury and a group including the Vice President's office were in Madrid 2 weeks ago to negotiate with the Chinese. And it was a result of President Trump's close relationship with Party Chair Xi that we were able to get this across the line. We created a framework for Party Chair Xi to agree. And then on the leaders' call, the Xi and President Trump discussed the final arrangement. So it was 1-2. And that was the final piece.
Will the U.S. government get any kind of annual payment as a result of this deal?
Taxes. It's going to make money, and we're going to get a lot of money in taxes. And you know, China wanted to see this go. It's a great legacy for China too. I thought President Xi was great in terms of his approval. We probably could have done it a different way, but it wouldn't have been the same. Wouldn't have been the same security at all, but I appreciated that he approved it.
So nothing aside from taxes, there's no part of the deal that is like a payment to the U.S. government.
Well, we're going to be announcing different things, but the U.S. comes out great. And I think China comes out great because they're going to have a very important legacy. And they have many other deals. You know, they have deals with us and they have deals in here in this country. And, you know, they want to be treated fairly also.
So, Mr. President and Mr. Vice President, the U.S. company could change the algorithm to push different content? Is that?
the U.S. company will have control over how the algorithm pushes content to users. And that was a very important part of it. We thought it was necessary for the national security element of the law. We also just think it's important to protect American users. Again, we want users to use this platform the way they want to. We want the business to make decisions about content based on the interests of the business and based on the interests of the users. And that's what we think will happen with this new arrangement.
And they're paying a lot of money, and I think hopefully it's going to be a great deal. They're very sophisticated people. You'll see a list. Have you seen a list yet of the people? Well, you've been reading about it. It's. I know Michael Dell's involved, and Rupert Murdoch's involved, and a lot of. And let's see, we have probably 4 or 5 absolutely world-class investors that love the country, and they made a lot of money with the country, and many of them are in a somewhat related business, so it works out pretty well. And they're going to be very careful about all of these questions that you've been asking.
Who else beyond Dell and Murdoch?
Well, it's a blue chip group of investors, and we'll be announcing more about who exactly is involved in the deal in the days to come.
Oracle's playing a very big part.
That's right, sir.
And Oracle really understands this. And I think they're actually, and they've been involved for quite a while running it for the people, the previous people. And so it's really, I think it's going to be very well protected. Very, very prestigious deal, actually.
On that point, Mr. President, as the President said, Oracle has actually had a role in housing the data for a long time, even when the entity was controlled by the ByteDance organization in China. So Oracle had a pretty interesting perspective on what was necessary to actually create true data privacy protections for Americans. They were a very important part of getting this thing done.
Mr. President, you told us a couple of weeks ago you thought that the security concerns were overrated, but were there legitimate concerns when it comes to safety?
From my standpoint, no, because the people that own it are, they're not China-centric, they're USA-centric, and they're very smart people. I guess you could say it about everything. Everything is what's secure nowadays. Things that you think are totally secure turn out to not to be. But I think in this case, it's going to be as secure as you can be because of the ownership and the people. And they have a big investment. It's to their advantage to make sure it's good and safe. Yeah. Anybody else? Do you have a question? No, behind you?
Well, I just want to say, do you think this move and getting this deal done, Mr. President, do you think this honors the legacy? Like Charlie Kirk, you mentioned that he specifically pushed you to get involved with TikTok in your campaign and help you win young voters. Do you think this deal honors him?
Well, I think it's a good thing. It's a good sign. We're doing very well, as you know, with the trade deals. We're doing very well with China, and a lot of them. We were never treated properly. We were for 4 years, actually, but we were never treated very properly by other countries, and we're doing well. We've never done this well. We have, because of the tariffs that are coming in, the deals that are being made, $950 billion in one case, $950 billion, where previously they paid nothing. We have, as you know, in Japan, it's $550 billion. South Korea is $350 billion now. That's up front. And one of the things I can say, I announced it lightly before, but we're taking in tremendous amounts of money with tariffs. We've never seen anything like it. No country's ever seen anything like it. I'm going to devote a little bit of that money, a little bit of the tariff money to our farmers. Our farmers have been incredible. They're the ones that let us survive and eat and enjoy our lives, right? Eat too much, maybe in some cases, like mine. But I will tell you, we're going to take some of the tariff money, relatively small amount, but a lot for the farmers. And we're going to help the farmers out a little bit because during this transition period, a period where we're taking in incredible amounts of money, we'll have a little bit of a shortfall with the farmers until the tariffs kick in because they haven't kicked in for the farmers yet. And I decided before, and I spoke to all of the people here, that I want to make a contribution out of the tariff money, a small percentage of it, but it's a lot for the farmers. It will make the farmers feel very good, just help them through the transition. And ultimately, they're going to be making a fortune. They will be one of the top in the whole world in terms of percentage gotten from the tariffs we're taking in. But we have so much coming in, it's a very small thing. But I want to, in fact, just get the word out to the farmer because they'll be struggling until the transition's complete. Then after that, they're going to do, I think, better than they've ever done before. Last time I said, get yourself a larger tractor and more land. And that was when they were doing very poorly. And they ended up doing that, and they did very well. That was with the deal we made with China. Unfortunately, Biden forgot about the deal, and he never enforced. I enforced it till the end, and China was very honorable. But when Biden came in, he didn't enforce it. So when you don't enforce a deal, they don't do it. So it's terrible. Biden was very bad to the farmers of our country. So we're going to be doing that. It's an honor to do it, too. Brian, did you have a question?
Yeah, I was just going to say, what's your message to the millions of small businesses here in the U.S. that really rely on TikTok to reach their end user, to market their service and their product?
Well, thank you for that question, because honestly, we were getting hit up. They use it for virtual advertising, and they pay very little for it and nothing for it. And small businesses have become very successful because of TikTok. And we didn't think of that, when everyone's saying, oh, TikTok and this and that. But over the last 6 months, I was called by so many people saying they're going to go out of business if they can, because they use it virtually as a advertising tool. And without it, they wouldn't have anything. They wouldn't be able to get the word out about their good product or whatever it is they're selling. So it's a very important thing for small business. It's another reason I wanted to do the deal so badly. So let's go to another subject now, if we might, okay? And Will, please. Yes, go ahead.
What does that look like? Is that going to be direct checks to farmers, or is it going to be?
Well, we haven't decided that. We'll be dealing with Brooke later, and the Secretary of Agriculture, and we'll figure out how to get money to the farmers. And again, this comes out of the large amount, hundreds of billions of dollars of tariff money that's pouring into the country. The tariffs, remember when I said a long time ago, I said it's the greatest word, it's my favorite word in the world. Then I had to say, I was forced to say other things, and of course, rightfully so. Love, family, religion. So I think I put tariff number 5. I was forced because the fake news did a big number on me. It's one of those little, but let's say it's my 5th favorite word tariff. But it's making our country very rich. And when our country is rich, I'm able to help the farmers, and I'm able to help even other countries that are in trouble. But we're able to help people that are in trouble. Medicaid, Medicare, Social Security. It's all a benefit of this tremendous amount. And I heard numbers coming in today, Scott, where the numbers were very high, right?
The economic numbers were off the charts, sir.
Unfortunately, right? Because this is the only country in the world where you announce great numbers and the stock market goes down. Because when you announce great numbers, they immediately want to take that success away by raising the interest rates. Why can't you announce great numbers and let them lower the interest rate so you can make numbers? This is the only country in the world. I don't know if you heard. Could you just tell them what the number was? And how
it was 3.88% growth, the biggest in years. And the important thing, as the president says, this is going to be non-inflationary growth, just like it was in its first term. So strong growth, low inflation, real wage gains. And to the question on small business optimism under President Trump last week hit a multi-year high. So small businesses, Main Street is back under President Trump.
But isn't it crazy? So I saw the market was down a little bit today. I mean, in all fairness, I don't feel guilty because we've set every record you can imagine. But it was down, and I say, oh, the numbers must be good. Meaning the growth numbers are phenomenal. And again, this is during, but a little bit of the heavy, the really success and the money pouring into our country through the tariffs. And I just say, why can't we have great numbers and lower the interest rates so we have even greater numbers? So people were saying, oh, the numbers are so good, they're going to have to raise interest rates. That doesn't have to happen. And there's no inflation. We have really, the only thing we have is great success. We're having unbelievable success. So the numbers are much higher than anticipated, except for by me and Scott and some of the other people. And they'll get a lot higher than that, too. But I don't want to, every time we have good numbers, say, let's take all the juice out by raising interest rates. It's so backwards. It's so backwards.
Mr. President, they don't appreciate the importance of the third leg of your stool, because trade, taxes, and deregulation allows for significant upside growth without inflation. So eventually, the people at the Fed will be able to focus on this like Alan Greenspan did in the 90s. You can have strong growth and low inflation, and I think we can get the stock market up, Wall Street, Main Street, both doing well.
And we want low interest rates. There's no reason that every time we announce these record numbers, these numbers are way above projections by, all the great geniuses out there. And I knew this was going to happen. So they had 71 different people and only 2 got it right. Me and another gentleman from, I think, my wonderful Wharton School of Finance, actually. So anyway, but I really want you to look at that. Every time we have good numbers, they say this is a good time because they're guarding against inflation that may happen in 2 years from now. We have to change our thinking. We should be rewarded for good numbers, not penalized.
So, Mr. President, is that 3.8? Is that the start of a 3% growth for the entire year?
The number was projected at 2 because we're in a little bit of a transition period, but that transition period's ending faster than we thought on tariffs. The money coming in is much greater than people thought, and there's no inflation, essentially. There's no inflation. We just went through the worst inflation in the history of our country under sleepy Joe Biden. He was sleeping. And the inflation was really bad, worst ever. They say 48 years, I'll take that too, but I think it was probably the worst inflation we ever had because of spending and energy going through the roof and everything else. By the way, energy is way down. And you're going to really be impressed when you hear what happened today with President Erdogan of Turkey. I think it's great for both countries. I think it's great. We have great relationships with a lot of countries. And you may be even more happy when you find out because we spoke with Bibi Netanyahu today, and we spoke to all the leaders in the Middle East who are great people, and we're getting pretty close to having a deal on Gaza and maybe even peace, which would be the first time in about, 2,000 years, I think? In the region, I'd say the first in, Steve, what would you say, first in 2,000 years or maybe 1,000?
2 millennium.
It's a long time. Yeah, go ahead.
Did Erdogan agree to stop buying Russian oil?
I don't want to say that, but if I want him to, he will. Yeah.
But he didn't take that.
Well, I didn't say okay, you stop, but I believe you. I believe he will stop it. Yeah. You know why? Because he can buy from a lot of other people. He can buy from a lot of other people. You know who really can't is Hungary. Hungary's got, they're landlocked. And they don't have a nice ocean where ships can sail in from all over the world. They have one pipeline coming. Because I spoke with, he's a great guy, he's a great friend of mine, but, that's a harder one for them. And Slovakia, too. They're sort of married to one pipeline. So I just don't want to have people go blaming them when, we spoke to them at length today, and it seems like that, for them it's a little, but that's not. Turkey has a lot of options. He's a great president, a very smart man, and he's going to take. He's going to do what's right. But we had a very good conversation having to do with the purchase of military equipment, etc. Any other questions?
Did you make a deal on F-35s, Mr. President?
I will be able to easily if I want. So we may do that. Yeah.
But not yet.
Well, it depends. He's going to do something for us. Yeah, please.
Is the U.S. going to have sanctions on Turkey?
Can I ask you? We're a few days away.
By the way, here we go with this guy. Go ahead. Let's go. Let's hear the question.
We're a few days away from the end of the fiscal year and a potential shutdown.
Right.
There's going to be a government shutdown?
Could be, yeah, because the Democrats are crazed. They don't know what they're doing. They want to have the border opened up so that criminals can pour in. We're doing unbelievable borders closed and people are coming into our country legally. They continue to want to have men and women sports. They continue to want to have transgender for everyone. They want to raise everybody's taxes at a number that's not sustainable. It's the only time in the world I've ever seen a party that wants to raise taxes. I grew up in a family where I watched politics, and I always liked it from the time I was very young, but I'd always see politicians say, we will lower your taxes. These guys, they campaign on raising your taxes, but they want to raise taxes very substantially.
Well, the one thing they're concerned about, look, Republicans have total control of Washington. You guys have control of the House, the Senate, there's you.
Well, when you say control, so we need 60 votes for this, and we have 53 Republicans, so we need 7 Democrats.
And those 7 Democrats and others are asking for an extension of the tax credit on people who get the Affordable Care Act and some other government-backed healthcare. So are you willing to negotiate
Well,
on
what
that
they're
issue?
really asking for is they want to pay for illegal aliens that have come into our country by the millions and get onto the rolls, and they want to pay. And our people don't want to do that. Our people are taxed enough. You know, we just approved the largest tax decrease ever in the history of our country, including the extension of the previous Trump tax cuts. The tax cuts that we just approved, they want to use those tax cuts to give the money to illegal aliens, people that came into our country illegally and that are leaving the country.
So why not
You know, there's been a self-deportation because of what we've been doing that's been incredible. Okay, yeah, please.
Secretary-Tax-Exempt is inviting military leaders from all around the country on Tuesday. Will you also be there?
From all around the country to what?
To Virginia.
He's inviting the generals and admirals to Virginia for a big meeting. They're not sure why.
Well, I know, I love it. I mean, I think it's great. Let them be friendly. Let them be friendly with the generals and admirals from all over the world. Why, is there something? No, but is there something wrong with it?
What is it about? Will you be there personally as well? And what is it about?
Well, I'll be there if they want me, but why is that such a big deal? I mean, the fact that we're getting along with the generals and admirals from all, remember, I'm the president of peace. It's good to get along. It's good. You act like this is a bad thing. Isn't it nice that people are coming from all over the world to be with us?
It's not particularly unusual that generals who report to the Secretary of War and then to the President of the United States are coming to speak with the Secretary of War. It's actually not unusual at all, and I think it's odd that you guys have made it into such a big story.
Is it a big story? I mean,
I don't think it is, sir.
I would think it's, no, but isn't it a good story? I mean, you know, we're respected from all over the world as a military force. You know, I rebuilt the military during my first term, and even though we gave a chunk of it away to Afghanistan. But we're talking Afghanistan too, by the way, about Bagram and about that. But that's a very small amount compared to what we rebuilt it by. But I rebuilt the military, and we're very respected. We have the strongest military anywhere in the world without question. We have the greatest equipment in the world. We're selling the equipment to other countries. And a lot of generals want to be here and they want to look at they're also going to be touring equipment sites. They're going to be talking about the newest weapons, et cetera, et cetera. But I think it's great when generals and top people want to come to the United States to be with our now called Secretary of War. Does everybody like the name? I do.
You said something
Yeah,
really
please.
interesting this week about Ukraine, that you thought Ukraine could get back all the territory that Russia had taken.
Yeah, they have a shot at it because Russia.
What prompted you to change your thoughts on
Well,
that?
because I've been watching the way what Russia's been doing. I'm very dissatisfied with what Russia's doing and what President Putin is doing. I haven't liked it at all. He's killing people for no reason whatsoever. And they are doing very poorly considering they have put it all out on the line. Their economy is going to hell. They're bombing the hell out of everything, and they're picking up a very little territory, if any. In fact, they're losing some territory. So I think it's been very bad for the reputation of Russia. This war should have been over. If this were our war, we would have had it over in 1 week. And they're getting into fourth year, Jeff. They're getting into the fourth year now. 4 years of fighting, and you see what they've taken. Now, the last month, they've taken very little, and you've been reporting on all the bombing, all the drones all over the place, 900 drones coming into certain areas like Kiev in one night. And with all of that work, they've taken over very little. So now I'm very disappointed in President Putin. I thought I solved 7 wars. In fact, we have a great leader coming. We have the Prime Minister of Pakistan coming and the Field Marshal. Pakistan Field Marshal is a very great guy, and so is the Prime Minister, both. And they're coming, and they may be in this room right now. I don't know, because we're late. And I said maybe they'd like to join they actually may be somewhere in the beautiful Oval Office. Yeah, please, behind you.
Did you promise leaders this week that you would not allow Israel to annex the West Bank? Is that something that you
I will not allow Israel to annex the West Bank. No, I will not allow it. It's not going to happen.
Did you speak with Netanyahu about this?
Yeah, but I'm not going to allow it. Whether I spoke to him or not, I did. But I'm not allowing Israel to annex the West Bank. There's been enough. It's time to stop now, okay? Yes, please.
Jasmine Crockett recently.
Jasmine Crockett. Remember when I said, is she a relation to the late, great Davy Crockett? I don't think so. Jasmine Crockett, let me tell you, before you even ask, she's a very low IQ person. I mean, if we ever had to pass an aptitude test, that's the one should take one because she shouldn't even be in the crowd. So I have no idea what you're going to, but I don't think we should waste our time. This is a low IQ person who I can't even believe is a congressperson. Between her and Ilman Omar and the group. You know, I met the head of Somalia. Did you know that? And I suggested that maybe he'd like to take her back. And he said, I don't want her. Okay, what else? Go ahead. Let's hear what Crockett said. Go ahead.
She compared ICE raids to slave patrol. I want to ask you.
To slave?
To slave patrol. I want to ask you if you think that there should be consequences for members of Congress who make these types of comparisons or use this type of language.
Well, I think she's gone over the line, and I think a lot of the people. Look, the Democrats have become radical left lunatics. They have policies that nobody's going to buy. And, I see what's going on in New York. We're going to have perhaps a communist mayor because it's split up. If the people would get together and have one candidate, they'd have, I think, a pretty good chance. But looks like maybe they're not going to do that. But we're going to end up with a communist mayor. It's not even believable, my beautiful New York. When I left New York to become president, it was a great place. But it was the beginning of bad things because we had de Blasio had just started as mayor. And I said, this guy's a real nut job. Went to Harvard to teach management. Can you believe it? He went to Harvard to teach city management along with the mayor of Chicago, who went to Harvard to teach. The two of them are teaching how to manage a city manage it into hell is what they do. But that was the beginning, and now we're going to go a step further. Now we're going with the communists. Can I be honest? I think it's the greatest thing to ever happen to the Republican Party. I really do. I think if a communist takes over New York City, I think that's a gift to the Republican Party. It's sad for New York, but it's a gift. And New York will recover because sometimes you need a shock like that to straighten you out. But it's politically, it's probably a very good thing.
Mr. President, immigration, crime, and the World Cup. Actually, so
That's a lot of
you have
questions.
a number of cities that are pushing back against your immigration deportation move as well as your crime initiatives. Some of those cities,
I don't think they're very much
but
pushing
some of those
back.
cities have World Cup games.
Yeah.
Seattle, San Francisco.
They're going to be very secure.
Could those games move if they don't cooperate with your crime?
Well, that's an interesting one, I guess, but we're going to make sure they're safe. They're run by radical left lunatics and that don't know what they're doing. Look at Washington, D.C. I just got numbers. There's like no crime in Washington, D.C. You, Jeff, will not be mugged walking down the street. You can walk down the street with your family. You can walk down your street with your wife, your daughter, your son, and you're not going to be. We took out 1,700 career criminals that we're not allowing back. And we have this city in great shape. There was a time when not long ago, when every single week you'd have at least one murder. And look what's happening with Washington. It's safe. I went to dinner in Washington just to prove a point. I gave a press conference in the middle of a street. I wouldn't say Secret Service was thrilled, but I did it. And here I am. Look, Washington, D.C. is such a great example of what can be done. We did it in 12 days. We made it very safe in 12 days, and now it's much safer than that. One other thing, I drove around Washington over the weekend, and I said, look at the difference. The grass looked great. Everything looked great. We had a lot of our National Guard, and we didn't ask them to do it. They did it themselves. They're proud. They're great. And they were picking up paper. They were cleaning. The place looked really beautiful. So we have a great Washington, D.C. We, as you probably know, we're going into Memphis, and we're going into some other cities, and very soon we're going to go into Chicago. It will be safe for the World Cup. If I think it isn't safe, we'll move it into a different city. Absolutely, we'll take the world. If I think it's not, it's actually a very fair question. If I think it's not safe, we're going to move it out of that city. If, like the governor of Illinois, who is, look, last week. Between last week and the week before, 11 murders, and 38 people were shot. Then he gets up and he says, this is a very safe. And then he says crime is better. The reason crime is better is because cash put about 5 months ago a whole team of FBI people there to get ready for when we go in, and they've lowered it a little bit, like 20, 25%, which isn't good enough, but it's a good start. But that was only put there because they're preparing for us to go in. And they've done, by the way, they've done a good job. So then Pritzker gets up, we've lowered crime 25. It's because the FBI was there. So no, if any city we think is going to be even a little bit dangerous for the World Cup or for the Olympics, where they have Olympic overthrow, right? But for the World Cup in particular, because they're playing in so many cities, we won't allow it to go to, we'll move it around a little bit. But I hope that's not going to happen. Yeah.
Mr. President, Director of Health this morning indicated that the shooter in Dallas had been using an app to track ICE. Does your administration have any plans to take down those apps or get them removed?
Well, I can't tell you about that, but it tells you when they want to wear masks or they want to hide a little bit, why that's so important. But these are great patriots, the ICE, and what a tough job they have. What an unbelievably tough job they have. And think of it, what are they doing? They're taking hardcore criminals out of our country and putting them back. These were largely criminals that were given to us by Joe Biden and his group of radical maniacs that surrounded this desk, just like these people surround the desk now, but they're not maniacs, they're very solid people.
Thank you, sir.
I'm glad I prefaced. But they're great. We have a great cabinet. We have great people. And he didn't have great people. He had terrible people. Look at Afghanistan. Look at the people he had running our military. That could happen. The most embarrassing day in the history of our country was Afghanistan. And 13 young people died. They don't ever talk about the 38 that were horribly wounded with legs and arms and everything else, really horribly wounded. So the country's respected like it's probably almost never been respected before. I think we're respected at a level, and a year ago it was a dead country. We had a dead country a year ago. This country was dying. It was really in bad shape. Let's talk about the next subject, can we?
One of the most powerful deterrents we have to violent crime is the death penalty. As you said, your administration has taken bold, decisive steps to ensure that Washington, D.C. is once again a safe and secure city for its residents and all who visit. This is a presidential memorandum that directs your Attorney General and your U.S. Attorney for the District of Columbia, Judge Jeanine Pirro, to fully implement the death penalty here in Washington, D.C., where the evidence and facts of a case indicate that the death penalty should be used.
Okay. Everybody understand? Death penalty in Washington. You kill somebody, or if you kill a police officer, law enforcement officer, death penalty. And hopefully there won't be that. So again, it's way down. I mean, we have had week after week after week where we haven't had a murder. I said that the other day in front of the president of Poland. The press was here, and I said, ladies and gentlemen, I'd like to announce that Washington, D.C. has not had a death in 4 weeks, a murder. And he looked at me and goes, is that good or bad? He's saying, what kind of a place is this? But it's true for years. I mean, every week, essentially, somebody got killed or more than one. And this is a very safe city right now. We don't play games. And, it's interesting. We took these careers out, career criminals. They call them careers. They left the word criminal out. But we took the careers out of here. And they're now brought back to their homes, or they're in jail, or they're in a jail in another country. And hopefully they're not coming back. And we have to maintain it. You can't just leave, and we have to maintain it. We've gotten along fairly well with the mayor. She's getting a party that hates that the city's becoming safe. I mean, they're actually criticizing her because the city's becoming safe. But this is right now a very, very safe city. This went from the most unsafe city in the country to the safest city in the country. There's no city any safer. That's a pretty big achievement. And we really did it in 12 days. But if you add an extra week to it, that'd be nice. And I mean, you can go out to dinner. Restaurants are booming. The restaurants were dead. They were dead. Even if you got to the restaurant, then somebody would come in and hold you up. They'd hold up the whole restaurant. They go to Uber. Young ladies in the White House, they'd call Uber for protection. They'd run to the car because they were petrified to be from the entrance of their building to the car. Now they feel safe. They're in the car, and then the car gets hijacked while they're in the back of the car. This is what we were living in. We were living in hell. People that work in the White House, every time they see me, young women in particular, say, thank you, sir. And I don't even ask them about what. I know exactly. I made their lives. Now they're living in a beautiful, glamorous place called Washington, D.C. with no crime, and that's the way it should be. Okay? This is the death penalty for somebody that kills people in Washington, D.C. I think it's capital. It's a very interesting capital punishment, capital city. Right? It's capital. But this is our capital city. We can't allow that to happen. People come in from Iowa to look at the Lincoln Memorial and they end up getting killed. It doesn't happen anymore. It's not going to happen. And if it does happen, it's the death penalty for the person that did it. And this goes into effect.
Yes, sir.
Right? Pam, is that right? Could you speak a little bit about that?
Yes, sir. Not only are we seeking it in Washington, D.C., but all over the country again. And as you saw very recently, we are now moving the inmates who were on death row, who Joe Biden or the auto pen commuted their sentences off of death row. We're moving them to supermax facilities where they will be treated like they're on death row for the rest of their lives, President Trump.
Okay, it's a big statement. Thank you very much. Okay. I see some of you shaking your heads very positively. Thank you, Brian. Thank you, fellas.
You said on the campaign trail.
It said it. Yeah.
The death penalty gives anybody illegal who can kill a U.S. citizen
That's
or
right.
a police officer. So this just reinforces your campaign promise.
That's right. And most people really like it. And Washington, again, it's going to serve as a beacon because you have to do it. These are bad people. When you look at that guy, the guy that killed the young lady in the train in North Carolina, that he'll be in trial for years. He'll get a good lawyer somewhere along the line. Somebody will come along, and what he did to that young lady, and she went into that train scared. You know, when she went in, the way she sat down, she was scared to just be there. She just wanted to not pay any attention to anybody, just not be noticed. And she had her throat slit. We don't want that in this country anymore. We're not going to have it in this country anymore. Thank you very much. Next.
Lastly, sir, this is a presidential memorandum on countering domestic terrorism and organized political violence. In recent weeks, months, and years, we've seen a tremendous upsurge in some highly visible, but also other acts of domestic terrorism and organized political violence being perpetrated by radical, politically motivated groups all over the country. What this presidential memorandum will do is set off an administration-wide response to that, ranging from the Joint Terrorism Task Forces to other components of the Department of Justice, to the Department of Homeland Security and Department of Treasury. We're looking at interdicting these groups, preventing them from performing acts of violence, and also looking at sources of organization and funding and support that prop them up and allow them to do the acts that they have been doing.
We're looking at the funders of a lot of these groups. And, you know, when you see the signs, and they're all beautiful signs made professionally, these aren't your protesters that make the sign in their basement late in the evening because they really believe it. These are anarchists and agitators, professional anarchists and agitators, and they get hired by wealthy people, some of whom I know, I guess, you know, probably know them. And you wouldn't know it. You're at dinner with them, everything's nice, and then you find out that they funded millions of dollars to these lunatics. Steve, could you say a couple of words?
Yes, Mr. President. This is a very historic and significant day. This is the first time in American history that there is an all-of-government effort to dismantle left-wing terrorism, to dismantle Antifa, to dismantle the organizations that have been carrying out these acts of political violence and terrorism. What we have seen, if you look at whether it be going back to the riots that started with Black Lives Matter and all the way through to the Antifa riots, the attacks on ICE officers, the doxing campaigns, and now the political assassinations, these are not lone isolated events. This is part of an organized campaign of radical left terrorism. It is structured, it is sophisticated, it is well funded, it is well planned. There is really no parallel like this to anything else in the country right now. There is an entire system of feeder organizations that provide money, resources, weapons, and when they're attacking ICE officers, they're attacking federal buildings, or they're isolating public officials for harassment, doxing, intimidation, and ultimately attempted assassination. It is all carefully planned, executed, and thought through. It is terrorism on our soil. Because of this executive order, Cash and Pam are going to have the tools they need, working with Scott, to take these organizations apart piece by piece. And the central hub of that effort is going to be the Joint Terrorism Task Force, or JTTF, which sits inside the Federal Bureau of Investigation. But for those at home who are worried about terrorism in this country, they need to understand, because of President Trump's strength, because of his vision, because of his leadership, we are now going to use the entire force of the federal government to uproot these organizations root and branch. And again, that's only possible because of President Trump and his leadership.
Thank you. Steve Karras, please.
Yes, as Steve was saying, Mr. President, thanks to your leadership, crime is going downward in a tremendous fashion, and that's what we want for every city in America. And the FBI's premier flagship enterprise, the Joint Terrorism Task Force, are honored to lead this initiative with our partners at Treasury and Homeland Security, because our citizens are being attacked by, as Stephen said, organized violence, and it's being paid for, not by them, by other people. So what we are going to do, combining forces as Scott and I have done in these last few months, is follow the money. People and organizations have collected funds and put them out into the streets of America and organized violence across our country. And thanks to your recognition of this and this executive order and the AG's leadership to lead out and prosecute these individuals, we are properly going to chase them down like the domestic terrorists that they are. And our streets and our communities are going to be safer because the JTTF and the FBI and Treasury and DHS and DOJ are going to combine forces like never before to root out this new evil that is perpetrating our criminal activities across our societies. And we are just so thankful for your leadership and recognition of it. It's not easy to do.
Good job. Thank you very much.
Who
Pam?
specifically do you want to target?
What?
Besides Antifa, is there a specific group or person you're targeting in this?
Any organized group.
Any organized
Any
group?
organized group who are committing these crimes, and we're working with the Secretary of Treasury. You know what law enforcement has told us under President Trump's leadership? He's taken the handcuffs off law enforcement. They can do their jobs now, thanks to you, President Trump, and that's what's happening. And all of these agencies that Cash mentioned, we work hand in hand together. Our prosecutors were following the money with Treasury. We're working with Homeland Security. Cash's agents, all of our agents, DEA, ATF, U.S. Marshals, combined are working, and with state and local government, to take these people off the streets who are jeopardizing lives.
Can I just illustrate this? So I was talking with Cash and Stephen about this a couple of days ago, sir. So I believe it was in Oregon where you had a federal building where there were men in black ski masks who were committing acts of violence, who were shutting down a government building. To the president's point, they don't come from nowhere. These are paid people. This is organized. They're committing acts of political terrorism on American soil. And it's time we had a government that looked out for the American people rather than the people who are committing violence against the American people.
When you go out to Portland and you see what's happening in Portland, this is like nobody's ever seen anything like it. Every night, and this has gone on for years. They just burn the place down, and you know the shop owners, most of them have left, but the few shops that are open, they just use plywood and just like 3/4-inch plywood. They don't put storefronts because they know it's going to be burned down. These are professional agitators.
Right.
These are bad people, and they're paid a lot of money by rich people, some of whom we know. I'm sure I know some. I don't. If I knew, I wouldn't associate because I'll be in trouble because Pam will say, "Why are you associating with this person?" But I will tell you that these are bad people, and they're paying a lot of money, millions of dollars. But take a look at Portland sometime. These are wild. These are crazy people, and they're trying to burn down buildings, including federal buildings. And on my list of things that I want to do before we finish up with the cities, because I think we're going to whip the cities back into shape. But we have to. We cannot let our cities, and that's a small example, but it's the most violent example. It's every night, and they've done it for years. You think maybe at some point they made their point, and what are they doing? But we're going to get out there, and we're going to do a pretty big number of those people in Portland that are doing that. They're professional agitators and anarchists. They're actually anarchists. Yeah. Go ahead. Why don't you defend? Let's see you defend them, Jeff.
No, I'm not defending anyone. I just want so that we can just explain this in our stories. Could you name a couple?
You don't explain it right, though, Jeff. Go ahead. Let's go. Maybe let's give you another chance. Go ahead.
Antifa, Soros. What names are we talking about?
Well, Soros is a name certainly that I keep hearing. I don't know, but Soros is a name that I hear. I hear a lot of different names. I hear names of some pretty rich people that are radical left people. Maybe I hear about a guy named Reid Hoffman. Somebody's a pretty rich guy, I guess, and I hear about him. I don't know. Maybe Could be him, could be a lot of people. We hear the same names, but they're bad, and we're going to find out. And if they are funding these things, they're going to have some problems because they're agitators and they're anarchists. These are anarchists. Really bad. Okay, yeah, please.
Mr. General, can you imagine, Mr. President,
Who are you with? Who are you with?
I'm with the Center Square. Sarah Rodriguez is my name. Sarah, there's also, as you know, Antifa is not just a domestic terror or now a domestic terror organization. It's also international. I know the Netherlands is looking at also designating them a terror organization. Have you been working with your intel community and your DNI to possibly expand that to making them designated
Yes,
an
we have.
international terror
Yeah, we have
organization?
been. Yep. It's an international. In many cases, it is international.
Mr.
Yeah.
President, on Antifa, if someone takes to the streets of America and says they're Antifa, what happens to them? What will happen to them?
Well, I'd say the maximum under the law, and we'll see. Now, if they kill somebody, we just signed a death penalty, so it depends where it is. But if they kill somebody, which they do, I mean, people are dying. You go out to Portland, people die out there. Many people have died over the years in Portland. Portland is, I don't know how anybody lives there. It's amazing. But it's anarchy out there, and that's what they want. They want anarchy. Like when they attacked Seattle and took over a big percentage of the city, I was going to go out and we were going to do a big number. They heard that, and everybody broke up all of a sudden. But you have governors that have to run that, and a lot of them don't do that. I don't like to go in. I'd rather have Pritzker's support when we go into Chicago. But if we don't have it, that's okay too, because we're paramount, and we will do what we have to do. We're going to make Chicago safe. We're going to make we're going to make as many as we can. And usually that involves a surge. But what we did with, in the case of Chicago, by having the FBI go out there 5 or 6 months ago, we brought it down a little bit. A little bit is 25%, so it's not so little, but it is when you're talking about the kind of crime and killings and murders that you hear in Chicago. But we're going to get it. Chicago's a great city. As the Union Pacific said, the head of the Union Pacific, who's a great guy, started off as a low-rung guy. He said he started at a caboose, and now he's the chairman of the Union Pacific. But he's a great guy. But he said, "Sir, don't lose Chicago." The way he said it, I said, boy, it really hit me. Here's a man that knows all the cities. The Union Pacific, I guess, is our largest railroad. And he knows all the cities. He's been doing it for 45 years. And he said, "Sir, don't lose Chicago." And the way he said that meant a lot to me. And we're going to go into Chicago very soon. We're going to take care of Memphis. We're going to take care of Memphis. You can't walk a block without getting shot. We're going to take care of that one. And just like we did Washington, D.C., and we're going to do Chicago very soon. Yes.
There could be an indictment on James Comey. Do you know if there is an indictment?
I don't know. I know it's going on because I read the papers just like you do, right? So I don't know. Do you have anything to say about that? Yeah.
Madam Attorney General, can you comment on a New York Times report saying that Justice Department officials have asked attorneys to target a George Soros-funded group? And is this executive order that you just signed a part of that effort?
I'm not going to comment on whether there is or is not a pending investigation, but everything's on the table right now.
I don't think anybody has to ask, because if you look at Soros, he's at the top of every. In fact, sometimes they say, could he be involved in this many things? But he's in every story that I read. Stories that I read keep talking about Soros, and so I guess he'd be a likely candidate. Thank you very much, everybody. Thank you very much.
Thank you, President.
Thank you. Yeah.
Thank you.
Community and operate to serve a public rather than a private interest. However, in recent years, the standard has come under scrutiny, and with critics arguing that it is too vaguely defined and too easily met by certain hospitals. So is this true? And if so, how are the nonprofit hospitals taking advantage of the vague language in the statute?
Well, thank you very much for that question. I'm a clinical doctor. I was a nephrologist for 40 years. So I really bow in front of the expertise of all these individuals here who are expert economists. But I would say that this idea of exactly what's a community benefit is very vague, and our organization has looked into this and have tutored me on this issue very well. I think the point is that hospitals really need to think very hard about the things that they waste their money on. And our point of view is that creating these DEI enterprises has been a huge problem. So let me just read a brief excerpt from a testimony by a nurse at the Mayo Clinic. I participated in an event. It was a 2-day event in early August, Mayo's 2-day Rise for Equity event, which offered in-person and virtual attendance for continuing education credit. It was designed for professionals, including many people in the hospital, administrators, doctors, hiring managers. The goal was to advance and direct policy programs and institutional initiatives across the medical landscape towards health equity. She said, I encountered nothing but indoctrination. I was told in no uncertain terms that racial and
Goldfarb,
social...
I've got 3 more questions I've got to ask.
I'm sorry,
I'm
I'll finish and I'll make my point. Sorry, racial and social justice is a known public health threat. I learned tips for recognizing and addressing microaggressions. I was told systemic biases in physical space and that such ideas as meritocracy and color blindness are myths. It's very hard to measure the impact of these kinds of activities on an organization, wasting time, wasting resources.
Thank you very much. Mr. Hill, should Congress think about ways to amend the community benefit standard? Why or why not?
Yes, they absolutely should. Taxpayers should know that there's accountability for this standard in return for the tax-exempt status, and that we can draw a direct line between what the hospital's doing and health outcomes. Having vague standards around activities that aren't tied to any actual outcomes and don't even require any specificity around the money spent, so there's no accountability, is a real problem.
Well, I appreciate that. Today's hearing, I think, underscores why this conversation actually matters. And the community benefit standard is supposed to ensure that hospitals truly serve the public and not just themselves. But when that standard is unclear, patients end up paying the price while hospitals enjoy tax privileges with limited accountability. It reminds us that when Congress delegates broad authority without sufficient oversight, agencies like the IRS can create policies that foster confusion, unfairness, and added bureaucracy in our healthcare system. Our responsibility now is to make sure that those standards are clear, enforceable, and truly aligned with the needs of patients and communities. I appreciate each and every one of you being here today, and I yield. The chair now recognizes Ms. Chu, the gentlelady from California, for 5 minutes.
Just 2 months ago, Donald Trump and Republicans rammed through their big, ugly law, the single largest attack on healthcare in our nation's history. It slashes $1.5 trillion from our healthcare system, including nearly $1 trillion from Medicaid and another $500 billion from Medicare. That means more than 15 million Americans are losing their health coverage, the greatest loss ever in our history. And it means premiums skyrocketing and hundreds of hospitals pushed to the brink of closure. This kind of financial pressure threatens the very hospitals that provide life-saving care and step up in times of crisis. In my district in the Pasadena area of California, after the Eaton fire destroyed more than 6,000 homes, Huntington Hospital transformed its auditorium into a skilled nursing facility for displaced seniors and open-day food pantry for families who lost everything. That kind of rapid response shows how essential nonprofit hospitals are to their communities and how much they rely on Medicaid dollars to stay afloat. In fact, the American Hospital Association reports that nonprofit hospitals provide a disproportionate share of unprofitable but essential services such as psychiatric emergency care, neonatal intensive care, burn units, and trauma centers. And in 2022, nonprofit hospitals provided an estimated $150 billion in total community benefits. In fact, nonprofit hospitals deliver approximately $10 in community benefits for every $1 received in federal tax exemption. So Professor Horwitz, since most nonprofit hospitals already operate on razor-thin or even negative margins, how will Republican Medicaid cuts undermine nonprofit hospitals' ability to provide those community benefits and step up in moments of crisis like what we experience with the Eaton fire?
I think Medicaid cuts are going to make things a lot harder. So hospitals, as you point out, exist in very different communities with very different needs. And we don't want community activities, we don't want community benefits to look the same across all communities. There is no one size fits all. We need to have hospitals be able to respond to the next fire, the next pandemic, or whatever emergency we have coming down the pike. So in fact, the flexibility of nonprofit law recognizes this need, and it's why nonprofit law does not and never has required charities to have the single purpose of relieving poverty. Right? We need the YMCA, we need museums, we need universities. None of those are organized solely to relieve poverty. So what we should be focusing on is what nonprofits do best, which is provide medical care. They are more likely, comparing apples to apples, to respond, to have services that respond to these kinds of crises, like substance abuse treatment during the opioid crisis.
Furthermore, in the big ugly bill, Republicans could have extended the Affordable Care Act premium tax credits that keep coverage affordable for 22 million Americans. But instead, they chose to let them expire. Now, on January 1st, premiums will skyrocket. Millions of people will be pushed off their coverage, and more patients will show up at hospitals uninsured. These patients will delay care until they're sicker and then flood emergency rooms, driving up costs for everybody else. So, Professor Horwitz, what does Republicans' deliberate choice to end these tax credits mean for hospitals already operating on thin margins?
I think the ending of the tax credits, the lowering of Medicaid coverage, the aging of the American population, and rising unemployment, and therefore the decline of employer-sponsored insurance, is going to put enormous pressure on the healthcare system, including hospitals, especially nonprofit hospitals, since they do tend to operate at lower operating margins. What this is going to mean is, to stay open, nonprofits are going to have to find money somewhere, and that somewhere has to come through their major service provisions. So they're going to have to offer more profitable services, again, raising prices and spending for the federal government and doing care that may not be needed, or they're going to have to cut unprofitable care, and that means care like obstetric care or care like even emergency room care, and we've seen this before.
Thank you. I yield back.
The chair now recognizes the gentlelady from New York, Ms. Maliotakis.
Thank you, Chairwoman. And the state of New York, which is where I come from, is different than the rest of the country in that all our hospitals are nonprofit due to state regulations. And specifically in my district, we have 2 nonprofit hospitals that are also service teaching hospitals. These are on Staten Island, and then I have 1 freestanding emergency department in Brooklyn. And these hospitals do a great job of serving our community and training the next generation of doctors, of nurses, of healthcare workers throughout their teaching programs. And I greatly appreciate the work that they do there and also in serving our community. In the last year, they served 1.5 million patients. They've treated almost 300,000 individuals in the emergency room. They've delivered 12,000 babies. And according to the 2023 990 tax forms filed by the hospitals in my district, they contributed over $300 million in community benefits, which included charity care costs, Medicare reimbursement shortfalls, health profession education funding, and reinvestments in the community. These reinvestments included free healthcare screenings, food insecurity programs, overdose prevention programs, and many other investments. But they also are considered major facility improvements and expansions projects to further meet the needs of a growing population, particularly in Staten Island, which is the only borough in New York City that does not have a public hospital. So my hospitals are taking on a higher rate of uncompensated care, and without their tax-exempt status, these reinvestment opportunities and community benefit contributions would not be possible. And so, at first I want to ask Dr. Bai, I agree that we must ensure that our nonprofit hospitals are effectively serving and that they're reinvesting in our communities in order to receive that tax-exempt status. And obviously the communities across the country, they face different challenges. And as I outlined, because we're the only public hospital, or the only hospital, we don't have a public hospital on Staten Island, I think our issues are unique. So my question is, how can we ensure that the nonprofit hospitals that are operating in good faith and spending their money effectively in the communities are not hurt by other requirements that could potentially hurt their, one-size-fit-all approach to tax-exempt status?
So let's say we have a bright line regulation saying every hospital has to provide whatever percentage of the revenue in child care. That will hurt hospitals struggling on the line. For example, if this year, without that requirement, the hospital could stay afloat, that hospital might be closer to bankruptcy.
Yes.
And second, if we have a bright line number, the number is always gameable, right? And then the large hospitals and politically connected hospitals will be able to do two things. One is to hire consultants to massage the number, try to look good, window dressing. Mm-hmm. Second would be to try to work with the regulatory process to change some little things in their favor. So that will create a very unfair environment for small ones. That's why whenever we see more detailed regulations, we see fewer and fewer small players, simply because the soil is toxic, they cannot survive.
Yeah. How can we improve oversight without overburdening the hospitals?
I believe—
That's for you or Mr. Whaley, Dr. Whaley, whichever.
I believe competition would help force everyone to do the right thing.
So it sounds like your hospitals in your district are doing a strong job in fulfilling their community benefit. We know nationally that is not always the case. And so I think that there can be policies that go into place nationally, whether that is standardizing community benefit reporting, following some of the suggestions from the Government Accountability Office in a hearing before this committee 2 years ago, in ways to strengthen community benefit reporting.
Mm-hmm. I just want to make sure they're not going to be overburdened and dealing with more paperwork and more, bureaucracy and red tape and some other things that could be hurdles and administratively. I think that's really important for us to consider as well. And one last question. On top of the community benefits that I've outlined, my hospitals, they provide 30,000 jobs in our community. And so they are the largest employer in my district. And Dr. Horwitz, how does the tax-exempt status allow for these hospitals to continue providing not only these key healthcare services, but the jobs for individuals that I represent?
So the national healthcare expenditures for 2024 aren't fully analyzed yet, but it looks like we've spent $5.3 trillion, or about 18% of GDP, on hospital care. So, take about 70% of that, maybe probably more for nonprofit hospitals. And you are, by simple math, looking at a lot of jobs, right? The nonprofit hospitals are a major employer in the United States. And if you put more financial stress on them through cutting Medicaid, through lowering rates of insurance, you are going to see some real cuts.
The chair now recognizes Mr. Delaney from the great state of Washington.
Thank you, Madam Chair. I want to thank all of our witnesses for being here with us today. We're discussing what my colleagues across the aisle are calling unfair tax practices at a time when the greatest transfer of wealth is occurring in our country. The Republican mega bill cut health care for over 15 million people across the country while handing a tax giveaway to billionaires. The Congressional Budget Office found that the effects of their law will result in working families paying more while the rich get richer. And this is in addition to several other ways Republicans are actively working to systematically dismantle our healthcare system. between cutting Medicaid, triggering over $500 billion in cuts to Medicare due to reckless spending, refusing to extend the Enhanced Affordable Care Act premium tax credits, firing our public servants who work on disease prevention, medical research, and solving future health crises, and slashing research dollars. This entire administration has been one broken promise to the American people, and definitely a broken promise on healthcare. And congressional Republicans have enabled this agenda. We know that these cuts to healthcare will hurt us all and cost us more in the long run. Our healthcare providers have been telling us for months, when people lose coverage, when they lose their insurance and healthcare becomes more expensive, everyone loses. Our communities lose. In the after effects of the big ugly bill, we know that hospitals have to provide more uncompensated care as a result, making it even tougher, especially in our rural areas. Dr. Horwitz, in your testimony, you note that nonprofit hospitals are more likely to operate at low financial margins. How do you expect these hospitals will respond to the healthcare cuts included in the Republican reconciliation bill and the increased amount of uncompensated care they will inevitably end up having to deliver?
With rising rates of uninsurance, somebody is going to have to pay for the care that people will need. And nonprofit hospitals, even if they did spend all of their profits that they could possibly earn on the uninsured in America, they could not cover the need.
Thank you. I think it's valuable to note that I also want to make sure that we ensure nonprofit hospitals are adhering to the requirements of the law. And during a hearing on the same topic last Congress, I discussed the Affordable Care Act's requirement for the IRS to audit every tax-exempt hospital at least once every 3 years to make sure that they provide sufficient community benefit. At the time, the GAO, the Government Accountability Office, noted that the IRS has not revoked a hospital tax-exempt status for failing to provide sufficient community benefits in the last 10 years. The Affordable Care Act made this a requirement because we knew it was important to ensure that hospitals were provided this needed benefit. However, over the last several years, Republicans have continually chipped away at funding for the IRS. And so it's ironic that they're concerned about whether these hospitals should have tax-exempt status while actively getting the agency and the work that would actually go into place to make sure we're doing these audits and we're enforcing any changes. So Dr. Horwitz, again, how can Congress work to ensure that nonprofit hospitals know what's expected of them to maintain their tax exemption status without putting these hospitals at financial risk at a time when our healthcare system is already under attack?
You know, we could continue to invest in the IRS while making sure we're focusing on all the benefits that nonprofit hospitals provide. An IRS that focused on major medical services would be very helpful to the system and would help channel nonprofit hospitals to do the very important work that they need to do. But we need staff, and we need enough staff in the exempt organizations division to be able to issue guidance to help the hospitals do their jobs.
Critically important. And just again, we have so many important hospitals and definitely nonprofit hospitals providing important services to our communities in rural areas as well, areas that are already feeling under attack from the big ugly bill that was passed and putting them at financial risk. And I hope we're focused on making sure our communities have access to great care. So thank you very much. I appreciate your testimony. I yield back, Mr. Chairman.
Thank you. Thank you, Chairman Schweikert, for holding this hearing today, and to our witnesses for being here. Hospitals play a critical role in providing health care in our communities. Nonprofit hospitals' tax-exempt status allows them to invest more resources in improving the access and quality of care for individuals in our communities. Indiana has some strong examples of hospitals that are using their tax-exempt status to expand care for some of the most vulnerable individuals and communities. My district has several rural communities that lack access to some of the most basic healthcare services, and our tax-exempt hospitals certainly help fill that gap. For example, St. Joseph Health System uses some of its funds they save through their tax-exempt status to operate a mobile medical unit to help increase access to preventative care across my district. Tax-exempt hospitals are subject to various reporting requirements in order to maintain their tax-exempt status. Dr. Whaley, in addition to certain legal requirements and the community benefit standard, I understand that tax-exempt hospitals are also required to file Form 990s for IRS review. This form requires nonprofit hospitals to report a lot of generic information about employees, revenue, assets, tax compliance, but tax-exempt hospitals are also required to include what is called Schedule H, which is used to collect information on activities and policies of hospitals as well as community benefits provided by the hospital during that specific tax year. In your opinion, are the current reporting requirements for nonprofit hospitals sufficient to ensure that nonprofit hospitals are providing real community benefits and operating within their tax-exempt status?
Thank you for the question. Indiana in particular is a market that has, I think especially at the state, employer, and community level, focused lots on hospital prices and hospital markets in the last several years. In regards to Schedule H, I don't think the current requirements are adequate. For example, many hospitals are parts of large conglomerates and mega systems, which often report a Schedule H at the system level, which does not allow for auditors, researchers, and policymakers to understand community benefit reporting at the individual hospital level.
Got it. And are there other pieces of information that you believe nonprofit hospitals should be required to report to the IRS?
In addition to reporting Schedule H's for individual hospitals, the current requirements for Schedule H reporting are often quite vague, and additional reporting requirements for Schedule H and detail on individual line item spending for Schedule H could allow for a more further detailed auditing and accounting of community benefit spending.
All right, thank you. And Mr. Hild, it should come as no surprise that given the massive value of nonprofit hospitals' tax exemption, some nonprofit hospitals choose to spend money in various ways. We have discussed the spending on real estate, stadium rights specifically, but I also understand that tens of millions of dollars are spent on advertising every year. That ultimately raises, of course, questions about why they chose to do this and whether advertising and marketing spending might be going on. While it certainly makes sense for some hospitals to spend money on advertising and marketing, of course, at the end of the day, nonprofit hospitals certainly want to make sure that patients know where and how to utilize their services. Is there an amount or type of advertising or marketing spending that seems unnecessary or frivolous to you? And if so, can you provide some examples?
Yeah, that's a great question, member. And I agree that there certainly are instances where you'd want a hospital system to be able to advertise specific services to a community to make sure that they're aware of those specific services and how to access them. What I would say is an egregious abuse of their tax-exempt status is spending large amounts of money simply on brand ID, on superfluous Super Bowl ads like we saw from NYU Langone, where they spent ostensibly $8 million to simply, promote their brand. I think most people in New York in that area already know where to go to the hospital, and if they're sick, to go there. Most people don't need to be told that via very expensive Super Bowl advertising. So I think when you have a situation where it's simply a hospital system polishing their own brand, that is a waste of money and an abuse of the tax-exempt status.
Thank you. Nonprofit hospitals are an important part of our healthcare system. And in some cases, the patient's only way to access care. We need to make sure that nonprofit hospitals that use the program responsibly are protected, while hospitals abusing the system are held accountable. Thank you, Mr. Chairman, and I yield back.
Thank you. Because I've lost Mr. Swazi for a moment, we're going to actually, under the committee rules, we're going to go to 2-1. Mr. Miller.
Thank you, Mr. Chairman, and thank you to all our witnesses for being here today. Maintaining the highest quality standards of care in our nation's hospital is a key priority. As has been discussed, nonprofit hospitals are deemed to be those operated for charitable purposes with a mission to serve the public good, providing community benefits. Nearly half of American hospitals are nonprofits, aimed at advancing the health of patients through charitable and community care, many providing innovative breakthroughs in treatment for their communities and the nation at large. In tandem, transparency of care is a foundational mission for our nation's hospitals and health systems. I understand hospitals in Northeast Ohio provided around $2 billion in community benefits in the year of 23, according to the most recent analysis we have. Such key efforts of others include a diabetes center in Cleveland's economically stressed areas, empowering public safety medics with life-saving training, groundbreaking cancer screening for first responders, supporting more than 20,000 food insecure children, and funding the Lead Safe Cleveland Coalition. A recent report also noted, compared to other states, Ohio hospitals spent more on community health improvement services, a positive sign that they're investing in upstream and unmet health needs. The mission of all hospitals and health systems, regardless of size and type of ownership, is to care for their patients and communities. Likewise, sound, accountable, and transparent use of taxpayer funds is paramount to ensure the highest levels of integrity in patient care. To Dr. Chris Whaley. Dr. Whaley, you noted in your testimony, nonprofit hospitals play a critical role in providing patient care. As you know, nonprofit hospitals carry a community service mission, and current statutory requirements mandate that hospitals must maintain a publicly available financial assistance program and conduct community health needs assessments to identify key health concerns, soliciting input from underserved, low-income, and marginalized communities. How can these benchmarks ensure the highest levels of transparency and integrity in community care in our country? And how can transparency be strengthened to demonstrate the full breadth and accountability of nonprofit, charitable, and community care?
Thank you for the question. And related to my previous response, I think there could be increased transparency on spending on each of those components so that we can essentially compare what is the value of tax exemption with the value of community benefits. I would also note that while many hospitals do provide, nonprofit hospitals do provide community benefits, many of the hospitals with the highest prices in the country are large nonprofit hospital systems. And so we pay for many of those services through the backs of patients.
Thank you for that, Doctor. Dr. Bai, note in your testimony, nonprofit hospitals face significant operational challenges, including declining collection rates on medical bills and low reimbursement rates for many patients. Many nonprofit health providers serve a large share of Medicaid patients. One major hospital system in my region delivers more than 50% of its care to Medicaid recipients. They also treat a growing number of Medicare patients despite the program's low reimbursement rates, as well as the uninsured. Please share your thoughts on how Congress can strengthen the viability of the healthcare system for patients, providers, and American taxpayers.
Thank you. I believe the root cause for the unaffordability of hospital care is a high price. It comes from the high operating cost of hospitals. If you look around other markets, technology always brings lower costs, but that's not happening in healthcare. Why? It's because of lack of competition. There's an example. One private equity firm purchased a hospital, especially nonprofit hospital. They cut the admin staff by 1/3 while still maintaining the quality of care. This is coming from a Journal of Financial Economics study looking at more than 1,000 deals. That's a conclusion. So that means at least there are some redundancy in the cost structure of many of our nonprofit hospitals. Without competition, why would any hospital CEO cut cost? There's no reason, right? So they want to become more lean in operation only when there is external pressure. So I believe once we have enough competition in the market, they will try to make their operation more efficient. That will directly lead to a lower cost of care. That is true affordability and access for our patients.
I'm smiling. Thank you. That was a very well and thought out answer, and I could not agree more with what you had just laid out. I won't name any hospitals within my district, but some of them are undergoing some of the same things and seeing how we can consolidate and do better. So I just want to say thank you for that answer moving forward. Mr. Chairman, I yield back.
Mr. Chairman, on behalf of my colleague, Mr. Panetta, I would like to ask unanimous consent to include in the record of this hearing the 2024 annual report of the Sutter Health, which serves his district.
Without objection.
Thank you very much.
Mr. Swazi.
Thank you, Mr. Chairman. I'd first like to start by associating myself with the remarks of Congresswoman Malliotakis from my state of New York, where all of our hospitals are required by law to be not-for-profit. And she was sounded in her remarks very praiseworthy of the not-for-profit hospitals in her district as far as the care they provide, the community benefits they provide, and the employment they provide. So I want to associate myself with her remarks. I feel the exact same way about the not-for-profit hospitals in my district as well, which is along the North Shore of Long Island and Northeast Queens in New York. So I want to thank the witnesses also for their time here today. I really appreciate you taking the time to be here with us and share your backgrounds with us. I want to ask you first, you're all aware that people in America are very concerned about their healthcare costs, right? Mr. Hild, you're nodding your head, right? You're aware of that? Dr. Goldfarb, you're aware of that? Dr. Bai, Dr. Whaley, Dr. Horwitz? And people's health insurance premiums are really high. And that's one of the things that they're really worried about is their health insurance premiums. And if you ask the American people, what are the issues you're most concerned about in America today? Most people say the number one thing is affordability and the cost of living. That's tied into the economy as well. But that's the number one concern people have. Now, I don't know if you're aware, but currently many insurance policies in America are subsidized by a premium tax credit that makes the Affordable Care Act insurance more affordable for people. And that premium expires on December 31st of this year. Are you aware of that, Mr. Hild? Are you aware of that, Dr. Goldfarb? Dr. Bai, are you aware of that? Yes. Dr. Whaley? Dr. Horwitz? Okay, so there are some of us, Democrats and Republicans, there are 11 Republicans and 6 Democrats, of which I'm one of them, are saying we should extend the premium health care tax credits at least for a year. I actually think it should be more than that, as part of this debate that we're doing now about closing down the government. Because if we let these premium tax credits expire, then people's insurance rates are going to go through the roof. So, and it's not just me, Democrats versus Republicans. I have Senator Tom Tillis said in early September, he said, I think it's a bad policy and bad politics to let these premium tax credits expire. And the co-sponsor of this bill with me, Congresswoman Kiggins, said that there are 33,000 people in her district that rely on this tax credit to make their monthly health insurance premiums more affordable. If Congress fails to act, those same Virginians will soon face shocking cost increases that could put essential health care coverage out of reach. We can't pull the rug out from under hardworking families. We must give Americans more time to plan. So she's talking, and then she talks about how much everybody's health insurance premiums would go up. And then Congressman Fitzpatrick says the same type of thing. Letting these subsidies expire without a plan would put health care coverage out of reach for millions of families in my community and across the country. This bipartisan targeted extension will prevent disruption, protect access. And it goes on and on with other members talking about how devastating this would be in their community. So based upon what you're hearing, do you think it would be a good idea for us at least extend these health care premiums for at least a year? I think it should be longer than that, to at least figure out a plan for us to how to deal with this so people's health insurance premiums don't go up. What do you think, Mr. Hild? Mr. Hild.
That's sort of out of the purview of what we issued our report on, but I would say that to your point about affordability and price control, I completely agree that the average person is focused on that. And that's why we think it's so important that hospitals focus on just the provision of healthcare and cut out any extraneous costs so that they can pass that savings on to the consumer. And I additionally say...
what would happen is a lot of people, if they don't have insurance because they can't afford it, they're going to show up in the emergency rooms of these hospitals. It's going to cause the cost to skyrocket. So let me ask Dr. Goldfarb, what do you think? Do we think we should let these premium tax credits continue?
Well, as I said before, I'm no expert on these issues. I must tell you, though, that I've been in meetings like this for 35 years. And the problem has been the rising and soon unaffordable cost of American healthcare. You people in Congress, you need to fix the healthcare system. And this is not about just changing insurance premiums. This is about a fundamental reform that must go on, and I look very forward to seeing that happen.
I think that's an excellent point that you're making, Dr. Goldfarb, but in the meanwhile, we don't want to see these people all lose their insurance. Dr. Bai, do you have a position on this?
Yes, I do. I don't think we should extend. The insurance is not the same as coverage. We have seen many people covered, but then face medical bills. Second,
so
the fundamental reason.
You're okay with these people losing their insurance?
No, the fundamental reason for the high premium is because ACA regulations prevent insurance companies.
No, but we can't fix that between now and December 31st, can we?
If we have the money to spend, let's fund the patient. Let them control the money. Then they make the choice. That will totally transform our healthcare market for everybody's benefit.
Very good. Thank you. Dr. Whaley?
In many states, insurance premiums are expected to rise 20 to 30%, which I think is a substantial,
No, some people are saying 50 to 200%.
Substantial shock for many patients. Having some sort of smoothing would probably be beneficial, but I think it's also important to recognize that rising hospital prices are a key driver of why insurance premiums are
Thank you so much. Okay, I'm out of time. Can Ms. Horwitz answer, or should I stop? Ms. Horwitz, you want to answer that?
Just make it official.
Yep, insurance prices are going through the roof, and now is not the time to increase insurance costs even more. So if the tax credits are allowed to expire, we're going to see even more people be uninsured.
All right, Mr. Bean.
Thank you very much, Mr. Chairman. A very good afternoon, and good afternoon, Ways and Means. And to our panelists, welcome. We're glad to have you here. If you're just tuning in, if you just turned on C-SPAN, we're in Ways and Means, and we're talking about tax-exempt status for hospitals. Now, we know all hospitals are different, and not all hospitals are like every other hospital, but we're trying to determine whether taxpayers are getting a good deal by Congress granting tax-exempt status to certain hospitals. There's always been a kind of an agreement that with tax-exempt status, we'll get more. We'll get more as these hospitals will give more in community care and investing back in the community than the amount of the tax-exempt status. But here's the numbers. Here's the numbers. It's no secret the value of tax exemption for nonprofit hospitals has ballooned in recent years, rising from $19 billion in 2011 all the way up to $28 billion in 2020. What some may not know is that during the same time period, the tax exemption value at $28 billion in 2020, we're only getting $16 billion back in charity care. So the numbers are already underwater. So Dr. Ba, does the difference in the value of the tax exemption for nonprofit hospitals and the amount spent on charity care suggest, do these hospitals still deserve tax exempt status?
I don't think so. That is coming from more than a century ago. At that time, hospitals were purely staffed by volunteers and only caring for the poor. Now time have changed.
I got you. No, thank you very much. So it's the numbers. I've done the math in my head and I've done it on paper, and it's something that Congress needs to look at. Now, I mentioned all hospitals are not the same. I know in Florida, we've got great hospitals that exceed what they're expected to do. UF Health, Advent Health, Moffitt Healthcare, Florida's premier cancer hospitals, was in my office today bringing their report card and showing that they're not on the naughty list. But Mr. Hild, IRS data from more than 2,400 nonprofit hospitals using 2021 IRS data showed staggering results, finding that 80% of evaluated tax-exempt hospitals spent less on financial assistance and community investment than the estimated value of their tax breaks. Some hospitals went on to, the study says they went on to spend money on DEI, green energy initiatives, amassing real estate portfolios, and advertising, spending money to put stadiums, their name on stadiums. What does that data tell you, Mr. Hild? What say you?
It tells me that some of these hospitals are betraying the fundamental agreement that they made when they took their tax-exempt status. The whole concept of providing that is that instead of profits going to shareholders or executives, they will be reinvested back into healthcare.
Should the IRS be more strict in interpreting, or should Congress come up and maybe re-examine the criteria for receiving tax-exempt status?
I think both of those would be a great idea. I think the IRS should be more stringent in what they count, but the Congress should probably act to make it clear what the constraints are and making sure that that surplus income from the provision of services goes back into the provision of healthcare.
Very good. I have concluded my questions. However, I'm not concluded with my remarks. We keep talking about these premium tax credits, and Dr. Ba, you brought up a great point. It's if we want to reduce the cost of healthcare, the extending these tax credits does not reduce the cost of healthcare. It just merely transfers the cost of it, continued back on the backs of the taxpayers. Let it be known that people on the other side of the aisle extended these credits during COVID. They're the ones that allowed them to end at the end of this year. COVID is indeed over. And I think if we're going to, as Dr. Goldfarb, thank you so much for your comments, healthcare needs to be fixed. We've got a lot of work to do, and just transferring the cost of it from one segment to another doesn't fix the problem. So Congress does have work to do, and members on both sides of the aisle, I look forward to working with everybody to make sure that happens. With that, Mr. Chairman, I yield back.
Thank you, Mr. Chairman. To all of you panelists, thank you for discussing this very important topic. Today's hearing topic is indeed important for a number of reasons. Tax-exempt hospitals back in East Texas, where I'm from, I can tell you play an incredibly beneficial role in our healthcare system, ensuring that the most underserved and vulnerable patients receive life-saving care. And I'm certainly proud of their valiant efforts. I worked closely with them as a county judge, as a member of the city council, and various roles throughout my time there in East Texas. And in my experience, it's clear that many nonprofit hospitals are like that, clearly across the nation, correctly utilizing their tax-exempt status to invest back into the community, ensure health care for the poor and underserved, and provide a broad benefit to the community at large, one that serves the broader public interest. But here's the concerning part. We're seeing growing evidence that far too many hospitals are using their funds in a manner contrary to the public interest and unrelated to appropriate patient care. And the trend is not good. Dr. Goldfarb, I want to start with you. In your written statement, you say, quote, "Too many of these institutions are squandering their taxpayer-backed resources on ideological experiments. To me, it is deeply concerning that some tax-exempt hospitals, frankly, any hospitals, are diverting dollars from underserved communities to DEI initiatives, climate activism, and something that they call gender-affirming care for children, which I think is an incorrect term. Things like puberty blockers, cross-sex hormones, and irreversible surgeries. In your testimony, your written testimony, you list just 5 hospitals that perform sex change interventions, including medications and surgeries, to over 1,000 children in 5 years. That would include places like Boston Children's Hospital, the Children's Hospital of Philadelphia, Seattle's Children's Minnesota, and Children's Hospital in Los Angeles. It's disgusting to me, and I want to ask, do you think spending money on these types of activities is what the community benefit standard was intended to achieve?
No, thank you very much for that question. Yeah, the hospitals have seen themselves as being sort of centers of social engineering here. And both in the DEI world, it was an idea of writing what they believe was the basis for healthcare disparities. Healthcare disparities amongst populations is a real phenomenon. But to attribute it to racism on the part of doctors was an easy way out and one without real evidence. And so they've invested enormous amounts of money in sort of changing the composition of the healthcare workforce with the goal of getting rid of healthcare disparities. And the evidence, in the medical literature is quite clear that that's not going to work. Better access is going to be the solution, both on the part of patients and the part of hospitals. And as far as the gender-affirming care, this has been a disaster. Huge amounts of money have been invested in these programs. The medical evidence is quite clear, and it's been suppressed by the sides that have advocated for it, that these children are benefited. There is no evidence that they're benefited. There's much evidence that the children are harmed by these large doses of drugs or terrible surgical procedures that have really changed their lives.
I completely agree, Dr. Goldfarb. It's harmful, I believe, physically and emotionally and in a number of different ways. Mr. Hild, you said earlier that we should, quote, cut out extraneous costs. Would you put these quote, gender-affirming care activities within your definition of extraneous costs that we need to cut out?
100%. Not only are they extraneous, they're extremely harmful to the most vulnerable members of our society, which is, of course, children. So I think it's both morally reprehensible that hospitals have engaged in this care, but also that they would try to claim that it's a community benefit.
Dr. Bay, do you think it serves a public interest for us to continue to provide tax-exempt benefits to hospitals that provide this kind of atrocious treatment to children?
No, I don't think so. For this or any other population harming activities.
What about you, Dr. Whaley?
I'm not a clinician, so I don't want to comment on any one individual's patient care, but I think these decisions should be made between the patient and the provider.
Yeah, I completely agree with the panelists that have said this is not the type of public interest that we need to serve with our tax laws. Certainly it's contrary, in my belief, to the greater public interest. This is not the first time that a few bad apples spoil the bunch, but the irresponsible use of these tax benefits in far too many nonprofit hospitals is contrary, to, as I said, to the public interest and belies the original intent of our tax code provision in this regard. Patient access to care, ensuring quality of care, and doing so in a manner that benefits the patient and the community at large should be the goal, not scientific experiments that are detrimentally harmful to our kiddos. Anything to the contrary to this stated appropriate goal should not receive and see special tax treatment. Mr. Chairman, I yield back.
Thank you. Members, notification, we're probably going to have votes called in a few minutes. If it's a 15-minute vote, we're going to try to race through. I'll ask everyone to be as efficient as possible. Dr. Murphy.
Thank you, Mr. Chairman. Appreciate you guys coming today. Quick note, I'm just not going to get sidetracked. The premium tax credits are a boondoggle for insurance companies. They say they're going to raise rates. It's only for their profits, period. Period. Look at the data. Yes, we can reform this, but most of that money went to insurance companies. So let's not be fooled who's making the money in this and where it's coming from. So, Dr. Goldfarb, America's doctors, nurses, and other healthcare professionals are not racist, sexist, or homophobic. They are deeply committed in caring people who work tirelessly every day out of love for the common humanity they all see in their patients. Spot on. I don't know what the hell has happened with the leadership in medicine. This has been the greatest peer pressure event since the Spanish Inquisition, that they feel DEI, equity over excellence, is good for patient care. Shame on all of them. And the fact that they are committing what I believe is medical malpractice on children for the sake of profits is dastardly and cruel. And thank God sunlight is now disinfecting some of these places. The Cleveland Clinic, Boston Children's, all these places should be absolutely ashamed of themselves for succumbing to peer pressure for the terms of profit. Thank you for helping highlight that nonsense. I'm going to drill down and get a little esoteric because both you and I understand in this. If we look at what's been going on, the DEI, the social justice, the climate activism, the gender transformation, we know that the AAMC, the LCME, the ACGME control a lot of these nonprofit hospitals through their residency and medical schools, correct?
Yes.
So these leaders of these institutions have been polluting medicine, polluting healthcare, polluting education, and then subsequently holding a lot of these hospitals hostage because they don't get accredited. The LCME come in like a bunch of bullies and comes in and tells you what you're doing wrong with no recourse. This is what's going on. All of these people, all the leadership need to go, period. They have destroyed medical education in this country. You and I both know this, but they hold so many of these hospitals hostage. I personally think any hospital now that has any gender-affirming care, anything with DEI, if they're nonprofit, boom, that status is revoked immediately. That needs to happen. So how do we get the AAMC, the LCME, the ACGME to reverse the course of nonsense that they've been doing?
Well, that's a big job. You know, unfortunately, the leadership of these organizations is usually voted on by a very small percentage of the organization.
And it's self-propagating.
And it's self-propagating. And you've been a great leader in this area, and we really congratulate you on that. I think this is going to require the public, it's going to require you all speaking out, us speaking out about this and making people aware. And I think there has been a change. I think there has been a sense that this DEI enterprise, particularly in graduate medical education, which is related to the hospitals particularly, the ACGME that regulates that and oversees it has now announced that they're going to rescind their DEI activities. Now, the problem is this going to be a lasting change?
Yeah, it's a shell game.
Is this just going to be a transient acceding to the current view and the current government that's in place? And I hope that's not the case. But we're fighting very hard. We're fighting with lawsuits. We're fighting with efforts at legislation around the country, and we'll continue to fight. And I think it's going to be a long fight, but it's one that we must engage in because it is important for the health of the American people.
I thank you for doing it. It honestly just reverses how long we've been trying to have objective scientific medicine. And when you let all this nonsense pollute what is medicine, you know, you and I have taken care of patients. We don't give a damn what they look like in front of us. This is just ridiculous. It's what has happened. Now, I'm going to diverge a little bit, going back to some of the nonprofit stuff. Why the hell should anybody have naming rights to a stadium from a nonprofit when they're going to cry that if Medicaid reform comes down, they have uncompensated care? Tell me how anybody can defend that.
I don't think it can be defended, especially, member, at a time when these hospitals don't provide any price transparency. They seem to be acting as if they've run out of ways to invest in the provision of care in a better or more cost-affordable way. If that's the case, then maybe they don't need these subsidies.
Well, you know, I get advertising, and I know it's a tough market in some certain places. I get it. But when you have been given a privilege of a nonprofit status, somebody commented earlier that I think it was Dr. Bai, they've just taken too much length out of their rope. And it's time to pull this back. And actually, boardrooms need to have their presidents and their CEOs now accountable to the American taxpayer. Thank you, Mr. Chairman. I'll yield back.
Thank you, Dr. Murphy. Mr. Davis.
Thank you, Mr. Chairman. And I certainly want to thank all of our witnesses for being here and sharing your expertise and experiences with us. The recent Republican law rips health care from more than 15 million Americans, shutters hospitals, kicks people off, takes people away from their nursing homes, and strips health insurance from millions of people. Today's hearing is yet another page from the Republican playbook to take from the poor, from the disabled, and from the sick to give to the wealthy. Today's hearing attempts to justify further wreckage of our healthcare system by stripping federal tax benefits from nonprofit entities that serve the needy to bolster for-profit healthcare with a special target on urban hospitals. Dr. Horwitz, as your elected representative, I'm grateful that you've come and sharing your time and expertise with us. Your testimony was especially insightful because you make clear that the community benefit of nonprofit hospitals greatly exceeds the dollar value of the free services they provide in so many ways, such as providing essential, low-profit, and less expensive services. So, Dr. Horwitz, could you please explain why nonprofit hospitals meet the community benefit standard in ways beyond a single measure of free care? And can you speak about how cutting the federal tax benefits for these hospitals would undermine nonprofit hospitals, destabilize the health system, and dangerously degrade care for the vulnerables needed?
It's a privilege to be here today, and I'm grateful to be represented by you. Today, we have heard from pretty much everybody on this panel, on the committee, of some particular thing that a nonprofit hospital does in their district to provide the services that are especially needed there. We've heard about construction of new facilities. We've heard about mobile medical clinics. There are countless examples of public benefit that's offered by nonprofit hospitals that is something different than free care for medically indigent patients. Free care is critically important, but it is certainly not the only care that's needed. In addition to these other services that we've heard about today, nonprofit hospitals do something that's very hard to measure. It's the dog that doesn't bark. They don't maximize profits. They don't offer services that are extremely profitable, but sometimes unnecessary. And that saves all of us money that we'd otherwise be spending. If more and more people become uninsured and more people don't have access to public insurance like Medicaid, then nonprofit hospitals will have to make up the money somewhere. And one of the places they'll have to do that is by providing these very expensive, sometimes unnecessary services.
Thank you very much, and I yield back.
Thank you, Mr. Davis. Ms. Miller.
Thank you, Mr. Chairman.
And forgive my interruption, votes have been called, so we'll try to.
Thanks. I appreciate the opportunity to be able to discuss the tax-exempt hospital statuses and what our hospitals are doing to fulfill their community benefit standards. I represent the wild and wonderful state of West Virginia, which has one of the largest rural populations in the country. Our rural hospitals go above and beyond to provide patients with the care that they need. Many of these rural hospitals can provide such community services with the savings from being tax-exempt entities. I think this is a fair trade-off for hospitals to make, but I've recently been alarmed at the growing trend of urban tax-exempt hospitals reclassifying as rural to receive additional benefits that are really meant to treat our most vulnerable rural patients. This spreads limited resources even thinner at the expense of many of my constituents. And I'm thankful for the work that two of our witnesses to do today, Dr. Bai and Mr. Whaley, to uncover more information about this trend. Dr. Bai, critical access hospitals are often the only site of care for essential health services in their community. The benefit they provide to their communities seems pretty obvious. These rural hospitals have been shown to provide a higher share of health services as a percentage of community benefit than other types of hospitals, including nonprofit community hospitals, children's hospital, and teaching hospitals. According to your recent study about the rise in urban hospitals with rural status in Medicare, there has been a sharp increase of geographically urban hospitals dually classifying as both rural and urban to access benefits intended for those hospitals serving our rural populations. Your study further showed that 3/4 of these dually classified hospitals were nonprofits and thus tax exempt. In your opinion, does this growing trend of dual classification lead to truly rural hospitals receiving even less resources to provide community benefits?
Absolutely. If Congress does not act to close the loophole, we're going to see more and more nonprofit hospitals do classified, taking advantage of the status. The result will be a smaller and smaller pool of money left for the truly rural hospitals located in rural areas. And that probably will not be the result Congress intended to see.
Thank you. Dr. Goldfarb, research suggests that the fair share deficit, or the difference between the value of tax benefits received and the value of community benefits provided by a nonprofit hospital, continues to grow each year. The fair share deficit at nonprofit hospitals was estimated at $11.5 billion per year from 2020 to 2022, suggesting that tax-exempt hospitals are spending significantly less on community investments and benefits than they receive through their tax-exempt status. Is this correct?
Well, as I said earlier, I certainly defer to these expert economists here that can speak to that particular issue. It is quite clear, though, that this community benefit needs to be clarified. The DEI enterprise, the gender affirming care, they've all been included in this idea of a community benefit. And I think one can really challenge seriously the fact that these enterprises, if anything, been divisive. Certainly the DEI enterprise, as I mentioned earlier, the Mayo Clinic having that 2-day meeting, which just leads to more animosity, more divisiveness, more unhappiness in the staff, and yet that's a huge investment. It's a huge investment in resources, it's a huge investment in dollars, it's a huge investment in human capital to these activities. So I feel very strongly that that's why this needs to be clarified by Congress, and the community benefit needs to be outlined much more clearly than it is now.
Thank you so much. I'll yield back my time. Thank you.
Thank you, Ms. Minister. Ms. Plaskett.
Thank you so much for the opportunity to speak here. You know, I live in an area that's not only rural, but isolated, living in the Virgin Islands. And we have, I must say, an amazing group of doctors who are absolutely dedicated to their profession. I know so because I know that they are working with very little support. We don't have a nonprofit or a profit hospital. We have government, local government-owned hospitals that are operating there. And in the Virgin Islands, because we're a territory, we have a TEFRA rebasing that's from 1992 and 1989, which means that our docs are not getting the level of reimbursement for the services that they're providing. The increase in cost of supplies has meant that vendors want money up front to be able to pay the cost of what it takes to take care of people. And we have a reimbursement of care that's only about 45% of what the revenues that they should be bringing in our hospitals. Our hospitals, the administrators, our doctors in the Virgin Islands are really almost victims of their own being able to juggle so many things and get things done. And at the end of the day, who's hurt by that? Not just the doctors, but of course the patient. 30% of the children in the Virgin Islands live in poverty, which means that Medicaid costs are absolutely skyrocketing. And rather than my colleagues talking about gender affirming care or engaging in the social disarmament that they're trying to do with the American people by raising people's hackles about that, let's talk about the everyday care, the everyday things that so many Americans are still not able to afford. Because this committee has not removed the cap on Medicaid for the Virgin Islands, even though it's been great that we now have a permanency rate of 83% by the feds and 17%, it means that because we're capped at Medicaid, all of the people of the Virgin Islands cannot able to receive care. And our government elects, rather than to go into debt and pay for people who are not there, to roll people off of Medicaid, which then increases uncompensated care, which then means that the hospitals do not get the revenues that they have, which means that they can't pay for docs. We have at one point one anesthesiologist in a hospital on one island. That's incomprehensible. In August, a large number of our doctors wrote a letter to our local government saying that they were fearful that they were not able to meet their Hippocratic oath because of the shortages in our hospitals. And so I think that the time that we have spent could have been really well spent talking about that rather than scaring people about very minute fractions of surgeries and care that goes on. But while we're discussing this tax exemption, I do want to know how the cuts to Medicaid and Medicare, which occurred in the Big Beautiful Bill, disproportionately harm territories, including the Virgin Islands, that lack charitable care structures that we've heard in some of these other tax-exempt hospitals provided in the mainland. I was wondering if Mr. Hild, you could tell me a little bit about that.
Well, I would just say that I certainly agree with you that we don't want our hospitals distracted, which is part of the reason that we do think it's important to look at these nonprofit hospitals when they're focusing on someone other than the provision of healthcare. And while I understand you characterize some of this as sort of a side item.
I asked, my question was, how do you think the Medicaid and Medicare cuts are going to affect?
I'm not a economist expert on those issues.
Dr. Horwitz, are you able to tell us how that may affect hospitals?
I think any cuts in Medicaid reimbursement and Medicaid coverage are going to make it harder for hospitals to provide care to the people who need it.
And how is that going to, why would that be? Because many people, my constituents, when I tell them about the Medicaid cuts, they may say, I'm not on Medicaid. So how does that affect me?
Well,
how would it affect someone who's not on Medicaid in terms of hospital care?
Because hospitals have to make out the money somewhere. And so they might do it by providing more profitable services that are not necessarily needed, driving up prices in other areas, and ending up having to have more crowded emergency rooms when people who are desperate come because they don't have any coverage at all.
Thank you for that, and I yield back.
Thank you. We're going to do a quick fire drill here because the fact of the matter, we're down to 2 minutes, 14 seconds on the floor vote. Look, Dr. Bai, I've read your stuff. As you did a paper, was it 2 years ago, on this? Dr. Whaley, I just read your testimony, but I'd like to actually read some papers. Dr. Horwitz, here's my problem. We're up here trying to understand something we're not experts in, and you're saying different things. I would love to actually line up my math and understand, because for all of us here, we have a small problem. 7 years from now, the Medicare Trust Fund is empty. We calculate that means in 2033, the first full year, the shortfall will be about 140 billion. And every year after that, it's going up 30, 40 billion dollars. The scale of what's going on, but you heard it here, and there's going to be a point I'm trying to make. My Democrat colleagues, even my Republican colleagues, we treat healthcare as a funding. It's a great sin. Is healthcare finance, or is healthcare the cost of actually delivering a service? I would argue that the barriers we have built into technology, the barriers, the incentives are misaligned, the information, other things we use. Look at the problems we have with the EMR systems and everything else. And maybe we need a fixation on how we change the actual cost of delivering healthcare instead of a constant debate of how we're going to finance healthcare. The discussion on nonprofit hospitals. I am going to send you all what we call QFRs, questions. We've had a running discussion on redesigning the 990 form, just so you as professors, you as researchers actually have better quality, and we as policymakers know what the hell we're talking about. Is a billboard, should that qualify as a community good, a stadium, or is it dealing with uncompensated care? You know, some of the questions should be obvious. The 990 forms, actually, if you've ever sat and read samples of them, let's have a moment of honesty. The IRS is supposed to be auditing these things like every 3 or 4 years, but what would you audit? The quality of the information is just not there. For those in the nonprofit hospital space, help us. I've asked this before and I've gotten zero. Well, Banner in Phoenix has been wonderful in sending me information and helping, but that's functionally my only one who's been saying, here's some ideas, here's some ways we could actually build data sets for you, could report it. We already have this because they have to do some of that for certain state regs. Help us build another way the IRS can collect data so we as policymakers on the Ways and Means know the value of tax-exempt status and that we're truly meeting the community good standards. Simple enough. And with that, I'm going to adjourn the committee, but do be prepared for some questions sent to you. And you can be fairly robust. I'm blessed to have some people much smarter than I am on staff who are capable of reading complexity. And maybe we can actually, next time we do this hearing, actually have it be a hearing of here's our solutions, what do you think? So with that, I would like to thank our witnesses for appearing before us today. Please be advised that members have 2 weeks to submit questions to be answered later in writing. Those questions and your answers will be made part of the formal record. And with that, we race across the street to go vote.
Thanks, Mr. Chairman.
Thank you.